Happy One Health Day. Welcome to those of you online. We hopefully will have a few more stragglers coming in to be here in person as well. So, One Health Day is pretty exciting. And it's exciting that we have at least the capability of being in person or doing some things in person this year with the pandemic. One Health Day actually started back in 2016, and it was started by the One Health Commission, the One Health Platform Foundation, and One Health Initiative team. It's international. So One Health Day is officially celebrated around the world every single year on November 3rd. And that's pretty awesome that it's not just us celebrating this day. It's everybody celebrating this day. The goal of One Health is to build the culture necessary for a sea of change on how planetary health challenges are assessed and addressed, and how professionals exchange information across disciplines. One Health Day is meant to bring global attention to the need for One Health collaborations and allow the world to see these collaborations in action. The One Health Day campaign is designed to engage as many individuals as possible from as many arenas as possible in One Health education and awareness events, and to generate an inspiring array of projects worldwide. Here at UT, we have the One Health Initiative. Hopefully, all of you, or most of you, have heard of the One Health Initiative by this point in time. But for those of you who haven't, our motto, our goal, is uniting disciplines to protect and promote the health of life on Earth. We want to do, and what we are doing, is reaching out across the University of Tennessee and beyond, forming and strengthening connections with the goal of solving issues. So what issues might we have here in Tennessee that would be One Health? Well, first of all, what is One Health? One Health is looking at how the environment, animals, plants, and humans are interconnected, and how the health of any one of those is impacted by the health of the others. We have a lot of issues that qualify for that in Tennessee. And here's just a couple examples. Food insecurity. Do you believe that there are people who don't have enough food to eat here in Tennessee? It seems kind of crazy, right? But it is a very real issue that we're having. Chronic wasting disease. That's a disease in white-tailed deer. How is that One Health? Well, a lot of people hunt and rely on that as part of their food. It's also part of our culture in our state. And we also have to consider that if this prion, this misfolded protein, is having such a dramatic impact on causing a disease in this animal, what is going to happen to that species? And how might it affect other species? What happens when you take that species out of the environment? How does that impact us? We have Thousand Oaks cankers. This is a fungus carried by a walnut twig beetle, and it's killing black walnut trees, including in the Great Smoky Mountain National Park. And it's not the only one killing trees. We have the emerald ash borer, an exotic beetle that's not even supposed to be here. And it also is killing trees, including in the Smokies. We have the Asian longhorn tick impacting our cattle, as well as other species. But this is a huge issue for the livestock industry. Of course, we are all aware of the opioid crisis, and Tennessee is definitely having severe issues with the opioid crisis. Along with the pandemic and the opioid crisis and everything else, we have a mental health crisis, which is probably impacting rural communities even more than elsewhere. So we need to be reaching out. But we've got to realize our problems are not our own. These aren't problems that we're only experiencing here in Tennessee. Not at all. They're being experienced elsewhere. And problems that are being experienced elsewhere, like in Australia, Brazil, Canada, anywhere else, we similarly experience them here. They impact us. Just think about some of the things that we've been experiencing lately. We've had fires, a lot of fires. And those fires on the West Coast, for example, have been impacting our air quality here on the East Coast. When the fires in Australia were going on, I was in the southernmost part of New Zealand, and the air quality was being impacted there. But it's not just that. It's not just the air quality. It's that those fires are taking out species of animals, of plants. We're seeing a lot of devastation, human lives lost, property destroyed, a lot of impact. And these are all One Health issues. And over the past year and a half now, we have watched a virus blanket our earth. And now more than 5 million people have lost their lives to this virus. And we've also lost other lives too, because there have been lots of animal lives that have been impacted as well. But if we're waiting until these pandemics, these disasters happen, we're only being reactive. And when we're being reactive, we're waiting until it's too late to do something. That's not the time to do something, because that is when it becomes super costly to try to do something. Not only costly financially, but costly in lives. So we need to stop being only reactive, and we need to become proactive. So we're taking command with a One Health initiative and building it within the areas of education, research, and outreach. In the area of education, we have initiated a minor in One Health. And you might say, why a minor? Why not a major? It's simple, because One Health is about bringing disciplines together. We've got to have people lending their expertise in architecture, engineering, communications, policy, public health, human health, animal health, and the list goes on. We've got to have all of these, including those areas that you don't always think about, like historians, communication experts, definitely. We've got to have those to work and to put these teams together. It's super important. Thus, it is critical that students get their major in what they want to be an expert in, but then they minor in One Health so that they can learn about some of these One Health issues. They can learn to be good team members. They can learn how to lead teams. These are important skill sets to acquire in order to work smoothly on a One Health team. We also put research teams together because sometimes they might be brand new ones, but most often it means building upon existing research areas to strengthen what we already have going on here at UT. We have amazing researchers, and our goal is to help them make their research stronger and help them build their teams. For outreach, we do a lot of outreach. For example, Heather Sedges, a faculty member and OHI scholar in UT Extension, is leading us in mental health outreach. In fact, she received a large grant specifically to address rural mental health. We're also partnering with folks in our state government, as well as our 4-H folks and extension agents, to build a One Health K-12 program that can be taken into schools, especially those in rural communities. And we can teach kids about One Health and the connection of humans, environment, plants, and animals. And I always say, if I can get people to understand one thing, it would be something as simple as biodiversity matters, because that's our foundation. It's a foundation upon which life exists. The stronger the biodiversity, the stronger and healthier we are. And when we start to take out species of animals and plants, yeah, sometimes they get filled in with exotic species. But either way, our foundation starts to get weak and crumble, and we start to have problems. And pretty soon we have catastrophes. So if we can keep that strong foundation, we can avoid a lot of these catastrophes. We've got to have a strong foundation. We've got to have a strong environment, good water quality, good soil. We've got to have good air quality. We've got to have strength in biodiversity of species. We have to have these things. So today our theme is climate change. And I realize that climate change is a very broad topic, but we hope to touch upon an assortment of contributions to climate change and the resulting impacts. Likely today, you will hear some things that are familiar to you, but perhaps you will also hear some things that you had not previously thought of, or maybe even heard of. It was really in the early 19th century that we started thinking about natural greenhouse effect. And by the late 19th century, we were starting to think, you know what? Human emissions of greenhouse gases could change the climate. And then we fast forward a bit and we look at the 1960s, and we have some evidence of the warming effect of carbon dioxide gas being more increasingly convincing. The 1990s, there was a consensus position formed that greenhouse gases were involved in most climate changes and that human-caused emissions were bringing discernible global warming. And since the 1990s, we have started modeling climate change and putting numbers to it, not thinking about it as one cause anymore or one result, but looking at all of the factors involved and all of the potential results. So today, I'm hoping that there's a sense that people are feeling the impact intensely enough that they finally acknowledge that climate change is real and that they want to do something about it. So with that, we have some amazing experts on climate change, including folks who work here at UT. Our first speaker is Kristie, presenting how climate change affects health.
Dr. Kristie is a professor in the Center for Health and the Global Environment at the University of Washington. She has been conducting research and practice on the health risks of climate variability and change for 25 years, focusing on understanding sources of vulnerability, estimating current and future health risks of climate change, designing adaptation policies and measures to reduce risks in multi-stressor environments, and estimating the health co-benefits of mitigation policies. She has supported multiple countries in Central America, Europe, Africa, Asia, and the Pacific in assessing their vulnerabilities and implementing adaptation policies and programs. She has edited 4 books on aspects of climate change, has more than 200 publications, and has been an author on multiple national and international climate change assessments. Please welcome Dr. Kristie.
Well, thank you very much for the kind invitation. Climate change obviously is a critically important topic this week, as the Conference of the Parties is going on in Glasgow. I'll talk a little bit about climate change and health and hopefully leave plenty of time for questions. I wanted to start with one of the conclusions I hope you'll walk away with, is that when we think about climate change and health, we should be thinking about children. In the United States, when you say climate change, people often think about polar bears. But when you look at the health risks of a changing climate, about 85% of those risks are in children. And so we should be thinking about children today and into the future. Climate change is a complex set of alterations to our physical environment. It's caused by emitting greenhouse gas emissions. The major one is carbon dioxide. And there are pathways by which carbon dioxide itself affects our health, separate from its impact on rising temperatures, sea levels, extreme weather and climate events. And those changes to our atmosphere, to our oceans, to the cryosphere, act on our health through a variety of intermediary pathways. And I've listed a few of those there. There's a wide range of demographic, socioeconomic, environmental, and other factors that influence the magnitude and pattern of health risks. And so when we think about what the consequences for our health with our climate change, we need to look at it in the context of a wide range of other changes. And this is where this clearly fits into the One Health paradigm. When you think about those interactions between climate change, all these other factors, they then affect the exposure pathways that those of us who work in health are quite familiar with. Extreme weather events and on across. Underneath, you can see a short list of the climate sensitive health outcomes that have been the focus of research. These are not all of the health outcomes of concern. A major challenge in our field is that there has really been no funding. And as we have more understanding of how weather and climate affect our health, the list of examples will only grow. All of the health risks of a changing climate are current problems. This means there's deep understanding of which individuals, which communities are at much higher risk. We understand the exposure and the vulnerability for particular groups. This slide is from the 4th U.S. National Climate Assessment and gives you some examples of some of the groups at higher risk and explains what can be done to help reduce their vulnerabilities. And I'll talk more about several of these as I go through my slides. I'm talking primarily about health, but need to remind everybody it's not just our health, it's our health systems. This figure, also from the 4th National Climate Assessment, shows Charleston County and Miami-Dade County and shows the hospitals that are at risk from different categories of flooding from hurricanes. It's not just these two places. Around the world, there are so many healthcare facilities in harm's way. It costs quite a bit to build healthcare facilities. It's an area where there is not a lot of profit margin for the people who build these. And so you often see the facilities built in places that are at greater risk, for example, of flooding, because the land is cheaper. And that is going to have consequences as we go forward and more healthcare facilities are affected. As I go through my talk, I'm also going to include some slides from the 2021 Lancet Countdown Report. It was published last week. And I hope you've taken a look at that. You can see that the overall message was code red for a healthy future. That message is being strongly taken to the Conference of the Parties that's going on right now. And you can see some of the conclusions on the right, that it's important as the world begins to recover from COVID, that the equitable response is applied as well to climate change. There are deep inequities when we think about climate change. The countries that are causing most of the consequences of climate change, most of the greenhouse gas emissions, are, of course, the high-income countries that are often better placed to be able to manage the changing risks. Those who are most affected typically are those who release the least greenhouse gas emissions. When you look within countries, it's the same pattern, that those who are poor and marginalized are at greater risk in general for climate change and are doing the least to cause the problem. I want to talk just about some of the issues. One of them is extreme weather and climate events. These are just the billion-dollar disasters through July of 2021. You can see there, I apologize, it's through September. So far, there's been 18 separate billion-dollar weather and climate disasters in the US. These are just billion-dollar climate disasters. They're not the $100 million climate disasters, the $1 million climate disasters. So these are just the worst of the worst. And these are costing the US hundreds of billions of dollars. When you hear that it's too expensive to address a changing climate, frankly, it's too expensive not to. That the US and other countries can't continue to pay for the extreme impacts from these weather and climate events, which of course are increasing in a changing climate. When the Lancet Countdown looked at some of these data, the data are categorized by the Human Development Index, the HDI, and it categorizes countries not just on GDP, but other measures of capacity. And you can see in the figure for the low Human Development Index countries, the low HDI, there's been an increase in the number of people affected, number of people who've died in extreme weather and climate events. For middle and high HDI countries, there's been a significant increase in the number of extreme weather and climate events, but there's not been an increase in the number of people affected. That our early warning systems, our infrastructure have been modified in ways that that vulnerability has not increased. When we think about extreme weather and climate events, I also wanted to point out the significant impact these events have on mental health. There are very good data from Public Health England. It's now the Health Security Agency in England. There's been several large flooding events. This one was several years ago. And usefully, the analysis was by houses, residences that were flooded, those where the residence was disrupted, and where there was no flooding. And you can see that the people who lived in these locations, lived in these particular residences, had very significant different experiences with mental health. And this is not long after the flooding event. You can see the large difference between the groups. There's been follow-up now for, I think, almost 4 years. And the numbers are reduced as one goes forward into time for probable depression, anxiety, and PTSD, but still elevated for people who lived in residences that were flooded over people whose lives were disrupted and those who were not flooded at all. If you did not hear, July was the hottest month ever recorded on Earth. That there's been temperature measurements, there's been rain gauges set out for almost 150 years. And this was the hottest month ever recorded. The land surface temperature in the Northern Hemisphere was 2.8 degrees Fahrenheit above average. And you can see around the world the number of warm records that were set. I live in the Pacific Northwest, and we had the heat dome at the end of June. So it's technically not in July, it was at the end of June, where temperatures were 5 degrees Celsius above normal in many places. There were about 1,000 excess deaths associated with that heat wave. So people continue to suffer and die in heat waves, and there is a lot that can be done about that. There's a lot that's known about the human body and how it responds to increasing heat. Our body has several mechanisms by which we can reduce that excess heat in our core body temperature. And when those fail, our core body temperature starts to rise. Our cells, our organs operate most effectively within a pretty narrow temperature range. And as the temperature goes above that range, you start seeing impacts on many of our organ systems. You see examples here, particularly for the heart. When analyses are conducted after a heat wave to look at the number of excess deaths, how many deaths occurred over and above what you would have expected during that time of year, you typically see that about half of the deaths are due to heart disease or some variation of heart disease. So we understand what heat does to our body, which means there's deep understanding of what we need to do to help prevent people from suffering and dying in heat waves. Overall, almost all heat-related deaths are preventable. And there's lots we can do to start taking actions to reduce that vulnerability as temperatures continue to rise. Overall, you can see since 1980, the exposure of vulnerable populations to heat waves has increased, looking particularly at adults over the age of 65 and babies. And you can see the numbers. These are from the Lancet Countdown. Children younger than 1 year were affected by 626 million more person days of heat wave exposure. Adults over the age of 65 by 3.1 billion more personal days of heat wave exposure than the average over 1986 to 2005. Real significant increase in all countries. There's been occasional declines, but not in the last 10 years. And this translates, as I implied before, into heat-related mortality. There's lots of different ways to count how many people died in heat waves. The best estimates come from doing the analyses I mentioned before of looking at excess deaths. The estimates for the US of the number of excess deaths per year from heat is about 12,000. So lots of lives that can be saved by taking effective action. Hundreds of cities around the world have heat action plans. These are plans that include both developing heat wave early warning and response systems and long-term planning for how to modify our cities as our temperatures continue to rise. You can see an information poster from Quebec on the left. You can see some information on the right for some other places in Canada that are taking action. And I did want to highlight again that the inequities here are very large. Particularly in the US, many of our red line districts have fewer trees and then tend to be much hotter than the surrounding areas. And so as there's work being done to help modify our cities for a warmer future, we need to think about how to do that in the context of reducing the inequities that are causing unequal impacts today. Many cities, as I said, have heat action plans. This is one from an area of India that's particularly hot and dry. It's not very far from Pakistan. And I wanted to mention this one because I just happened to be at one of the first meetings of developing this heat action plan. And we had a meeting with one of the local hospitals. They have air conditioning, but really not very much air conditioning. And we'll just say that there was issues in a recent heat wave with the neonatal ward. And that neonatal ward was on the top floor of the hospital underneath a metal roof. So one of the actions that was taken to help reduce the risks to babies during heat waves was to reorganize the hospital and move that neonatal ward to a place that was cooler within the hospital. It's just an illustration of how when we think about these health risks, they're all of society risks. And we need to think about how we can interact with other sectors to make sure that we do protect and promote human health, even as our temperatures continue to rise. Wildfires, particular issue here in the Pacific Northwest. You can see from the Lancet Countdown that there was an increase in the number of days people were exposed to very high or extremely high fire danger. And that's going to continue to increase because of climate change, stressing our forests, because of forest management, because of changes in precipitation patterns. We know that wildfire smoke increases risk for diabetes, lung disease, and heart disease. I put this particular figure in. You see the air quality index across the bottom. That is for PM 2.5. And you can see it goes up to 120. 2 summers ago, when we had particularly bad smoke blowing into Seattle, the air quality index in my neighborhood was 250. In Los Angeles this summer, one of the neighborhoods that was receiving extensive wildfire smoke had an air quality index of, I think, 745. So the exposure levels are really high, putting, again, vulnerable people at very high risk. If we were in person, I would ask how many of you have allergies or asthma. It's usually about 1/3 of the population. With climate change, our summers are getting longer. Spring starts sooner, fall starts later. You can see on the left, this has resulted in a change in the ragweed season. And you can see that in parts of Saskatchewan, we're looking at almost a month longer in terms of how long the pollen season is. Even in your region, you can see several week longer pollen season. Carbon dioxide itself affects pollen production, and at higher concentrations of carbon dioxide, there's going to be a lot more pollen. So a world with more pollen, more allergies, and probably more asthma. On the bottom, I don't know if you've got poison ivy. We don't have it here in the Pacific Northwest. I know it's throughout much of the Midwest, but you can see that with more carbon dioxide, there's more of the toxic oils in poison ivy. One of the biggest, probably the biggest challenge we're going to face in terms of the risk for health is in food security. Right now, there's 600 to 700 million people in the world who are food insecure. The reason it's such a concern is shown on this slide. This is for wheat. It's true for other cereal crops as well. Not all the crops are affected as strongly as wheat, but between wheat and rice, they constitute about 85% of the calories around the world. You can see in temperate regions on the left, as local mean temperature increases, depending on assumptions about adaptation in the blue and in the red, you can see that there's very little change actually in wheat yields. The problem is the tropics. You can see that with any increase in local mean temperature, a decline in crop yields. And that has impacts on the people who are already food insecure. The figure on the left shows how under different emissions, low and high emissions, in 2030 and 2080, different climate models, what the projected change are in crop yields. Right now, we're still, unfortunately, under high emissions, and you can start seeing a pretty significant decline in crop yields, depending on the model that's looked at. On the right, this shows you this decline in crop yields translates directly to stunting of children. With large increases in severe stunting, and you can see that towards the middle of the century, we're talking about very large increases in the numbers of children who are at risk. As I mentioned a moment ago, it's not just warming temperatures, it's also higher concentrations of carbon dioxide in the atmosphere. You may have read that CO2 is a plant food, and that's true. 85% of our plants have a particular mechanism whereby they pull in carbon dioxide from the atmosphere, break it apart into the carbon molecule through the photosynthetic pathway, and use the carbon to grow. So yes, CO2 causes most plants to grow, but it also changes the internal dynamics of the plant, and you end up with more carbohydrates. and about 10% less protein, about 5% less micronutrients, and on average, about a 30% reduction in the B vitamins. The micronutrients are particularly important because there's about 2 billion people around the world who have micronutrient deficiencies, and of course, many more who are susceptible to that. There's something like 1 to 1.5 billion women and girls worldwide, including in the United States, who have iron deficiency anemia. So the reduction in the concentration of the protein and the essential micronutrients is projected to affect hundreds of millions of people around the world as CO2 concentrations continue to increase in the atmosphere. This study tried to pull together the positive influences and the negative influences of climate change, technology change, this penalty on nutrient content, to look at the global availability of dietary protein, iron, and zinc. And you can see, even taking into account the positive influences, that by mid-century, it's projected there'll be decreased growth in the global availability of protein, iron, and zinc by 15 to 20%. So again, hundreds of millions of people are likely to be affected unless there's a lot of action taken today to understand how we can really get around the carbon penalty on nutrients. Moving on to everybody's favorite topic, vector-borne diseases. I put this cartoon in because, of course, the mosquito has to be Betty, because it's only female mosquitoes that need the blood meal to lay their eggs. I'm not going to go through this slide, but I wanted to just highlight that there is quite a lot known about how temperature and precipitation affect the development, survival, and reproduction of mosquitoes in this case. And in turn, temperature affects the replication and the transmission of the viruses that mosquitoes can carry. There's a slightly different cycle for ticks, but again, for ticks, there's very strong influence of temperature on the survival of the tick and the transmission of diseases such as Lyme disease. The mosquito we're particularly concerned about with climate change is Aedes aegypti. It can carry dengue fever, can also carry Zika virus, chikungunya, and yellow fever. And this is some pretty interesting modeling work. On the left, it shows suitability for Aedes aegypti. And the beige areas are places where the climate is currently suitable for Aedes aegypti. By and large, vector surveillance in the United States is not where it needs to be. So these are based on models, they're not based on actual vector surveillance programs, although they've been verified where it's possible. And under high greenhouse gas emissions in the red area, you could see where the climate would be suitable for Aedes aegypti, including around Seattle. But it's not just having suitable climate, you have to have a summer that's long enough and hot enough so that you can have dengue fever, for example, introduced. Somebody comes in with dengue fever, is bit by a mosquito, the virus replicates in the mosquito, and then is then transmitted to another human being. And you can see a very significantly reduced increase in the range for suitable transmission for Aedes aegypti, which is great. It's a very positive, not great for the Midwest, but it's very positive for much of the country that we wouldn't see such a huge expansion of Aedes aegypti. However, breeding colonies of this mosquito in 2017 were found in Toronto, Toledo, and Detroit. This is a mosquito that is very difficult to control. It'll fly a mile to bite a human. It replicates in the water in the bottom of a flower pot. It lives around our houses and very, very difficult to eradicate. Also, Aedes aegypti has figured out that sewer systems are a great thing, and it can overwinter in sewer systems. I haven't done so, but entomologist colleagues have gone into sewer systems and said there's millions of mosquitoes down there. And usefully, we've got ways for them to come and go from the sewer systems. And so we're seeing these mosquitoes overwinter in places where you think it would be too cold. The bottom left, so just for San Francisco, a large increase in the number of mosquito days just from the 1980s. And that will, of course, continue. And just like with heat, there's lots of opportunities for developing early warning and response systems. The top figure shows the difference between having no surveillance for some kind of disease versus passive surveillance when there's an outbreak. And that's a real traditional curve, outbreak curve, and showing that even with passive surveillance, that you can start detecting the first case early, you can start responding early, and that means you can really reduce the number of people affected. The second figure shows even greater opportunity with developing early warning systems using environmental information. For example, Singapore has one of the best control programs for Aedes aegypti in the world, and they're developing an early warning system. We're using information primarily about temperature, but using other environmental information, they can forecast up to 4 months in advance when the conditions would be appropriate for an outbreak of dengue. And that's 4 months to warn pregnant women, to clean up breeding sites, to have educational programs. And in that case, you can really make a significant impact. So as we go forward, we're going to see much more effort on developing these early warning systems to take advantage of the data that have already been collected.
Sorry to interrupt. I think your slides were frozen, but it looks like we're back on track now.
Okay, they've obviously been working on my side, but if you'd let me know. Okay. I want to move on to something that's been used for quite a few years, since 2001, in the Intergovernmental Panel on Climate Change. And it's a way to synthesize a lot of information into a visual image that's been very useful for decision makers. Because of the color scheme, we call these the burning embers. And these are the burning embers that were published in the IPCC Special Report on Warming of 1.5 degrees. And I'll speak from warm water corals so you can understand how to look at all of these. The zero line are pre-industrial temperatures. As you go up the y-axis, it's increases in global mean surface temperature above pre-industrial. The gray bar was the global mean surface temperature at the time we were working on the report, or just before we were working on the report. You can see 2006 to 2015. The Earth has now warmed about 1.2 degrees Celsius above pre-industrial. When you look at each of the embers, the white area indicates that we haven't been able to detect whether there's been any change in the system in warm water corals. And so we don't know if climate change has made a difference or not. It may not have made a difference. It may have made a difference, but we can't detect it. If we don't have surveillance systems, the system's complicated. There's a bunch of reasons why it'd be difficult to detect. When the color turns to yellow, it means that there are impacts attributable to climate change, that there has been a formal process of doing detection and attribution, and we know that climate change is affecting the system. Red indicates the risks are severe and widespread, and purple is very high risk, with the presence of possibilities of irreversibility. The report concluded for warm water corals at 1.5 degrees of warming, about 75 to 90% of warm water corals would be gone. At 2 degrees, they could all be gone. And this just speaks about the warm water corals. It doesn't talk about the hundreds of millions of people who get most of their protein from the sea. And what's going to happen, particularly in small island countries in the Pacific and in the Caribbean, when they lose those corals, lose the reef fish, and then what's going to happen in terms of their food security. On the far right, you can see heat-related morbidity and mortality. I'll talk about that more in a second. We just published Burning Embers for Health. So these follow the same color scheme, follow the same baseline is pre-industrial temperatures. We did the embers for heat-related morbidity and mortality, for ozone, for West Nile, Lyme disease, dengue. Sorry about that. Trying to close the bar at the top. I'm not succeeding in doing that very well. We also took a look at how development matters. The SSPs are shared socioeconomic pathways. They're visions of how development could evolve into the future. The ember on the right for each of the set is a world with very high challenges to adaptation and to mitigation. And the ember on the right is a world aiming towards sustainable development. And so you can see when you look at these, a couple of things. One, how the health risks are projected to increase with each unit of warming. And you can also see how much our development choices matter. How we urbanize, what we're going to do about wash. All kinds of factors will affect how vulnerable future populations will be to climate change. When we think about what needs to be done, countries are developing national adaptation plans. This is also from the Lancet Countdown. And you can see that a survey was conducted by the World Health Organization of the 196 countries in the world. About 91 reported. Of those, half basically have national health and climate change strategies or plans in place, but most of them said that they had insufficient funding to be able to attack the various challenges with new interventions, with new programs, in some places with new infrastructure. When you look at the amount of funding that is going out for adaptation across the world, only about 0.5% of all of that funding has gone to health. So countries are starting to do more to identify what it is they need to do to have climate resilient health systems, and they need the resources to be able to do so. And I wanted to end with a couple of comments about our carbon budget, particularly in the context of what's going on this week and next week at the COP, and talk a little bit about health co-benefits. There's been decades and decades of research about our carbon cycle, of what happens when carbon is released into the atmosphere. Most of it goes eventually into the oceans, into the soil, into rocks. It takes over 100 years for the carbon dioxide in the atmosphere to come to equilibrium. And from this deep understanding, it's possible to estimate the carbon quota, in this case for a 66% chance of keeping warming to below 2 degrees C above pre-industrial. When you look at the figure, you can see in black the total quota. In dark green, you can see the non-CO2 emissions that have already occurred, methane, for example. In the medium green, you can see past fossil fuel emissions. So these are our carbon dioxide emissions. In the lighter blue, green color, you can see past land use change. And in the blue, you can see the total remaining carbon budget. That's it. And this is why the negotiations are so intense. That if the US and China don't rapidly reduce their emissions, they will use up that carbon budget in a couple of decades. And that's why you'll see so much discussion coming out of Glasgow about what countries are going to do to reduce their carbon budget so that there is carbon dioxide essentially available for the low and middle income countries. All countries have developed in the past by burning fossil fuels. The low and middle income countries have every right to develop. And so there needs to be, for them, access to new technologies so they don't have to burn fossil fuels, but there also needs to be a buffer in case in the short term they need to. If you're not aware, when we look in the United States, our #1 source of greenhouse gas emissions is transportation. So finding ways to reduce emissions from transportation is as important, if not more important, than reducing emissions related to generating electricity. An important message that we've been trying hard to get out to policymakers is when you look at all the opportunities we have for reducing greenhouse gas emissions, almost all of those have health benefits. And when you start counting up the number of avoided premature hospitalizations, the number of avoided premature deaths, and you value those. Economists like to value the cost of hospitalization, the cost of a premature death. The value of those health benefits are larger than the cost of mitigation. We should be mitigating for our health. And we really hope that this message comes through much more strongly in Glasgow, so countries understand that yes, there's a cost to mitigate, but the benefits for their population are going to be larger than those costs. Just one example, again, from the Lancet Countdown of thinking about changing dietary patterns in the US so that people don't eat more red meat than their doctors recommend, because that excess consumption of red meat means increased mortality, increased morbidity, increased cost to our healthcare system. And with that, I really appreciate you listening and look forward to some questions.
So do we have, if you guys could either type in your questions into the chat, that might be useful, or you can unmute yourself and ask your question. And I can actually start if we don't have a question to start with, because I actually have several, but I will limit it slightly because Alyssa will tell me how much time we have. Yes, that 2 degrees difference is so amazing. And I always try to stress that to students. How do we get across to people that it's 2 degrees, doesn't sound like much, but it's huge.
There are so many good metaphors that you can use around that. One that we've been using for a while is when you think about people using performance-enhancing drugs. And you can use examples of any number of athletes who were accused of using performance-enhancing drugs. I will not opine on whether they did or not. But when you look at how little they take and what a difference it can make in their performance. So we have lots of examples where just a small change in an input can have a huge impact on the output. And we can start thinking of other examples to use, but those kinds of examples in terms of the drugs, the performance-enhancing drugs, anybody who's got any kind of disease process where they need to take a drug, you're really putting a small amount into your body and can have a benefit or can have a pretty significant impact.
Well, I will say that in our laboratory, we have shown that just 2 degrees difference can mean a host will live and not be affected by a virus versus dying from it. So it's pretty huge. And I think we have some questions in the chat.
Yeah. In the chat we have, Dr. Pfefferman said she would love to hear your thoughts on best practices for communication, advocating, adopting mitigation strategies.
That's a great question. One of the issues I didn't cover is I hope you've looked at the 6 Americas. The 6 Americas is a program that's run out of Yale. And if you just put in Yale 6 Americas, it comes up right away. And they have been surveying the US population for quite a few years about their opinions around climate change. And it's been fascinating to watch those opinions and how they've shifted over time. I think it's 2/3 or almost 3/4 of Americans are concerned about climate change. More than 50% thinks that the US should be doing something about climate change. This is much different than what you see in the media, but this is an actual survey of people. And one of the last surveys came through and very positive results on the number of people who understand climate change, understand it's a risk, number who think it's a risk for their own health. But one of the really interesting results was they asked people if they talked to other people about climate change. So you're talking about 2/3 or 3/4 of Americans concerned about climate change. and only a third ever talk to anybody about it. It's different on a college campus. Students do talk to each other. We do talk about it in classrooms, but people don't go out and talk with their friends, their families, their colleagues. And we need to have that happen to build the political will to make a difference. I think people would be surprised. There certainly are people who are still skeptical about climate change. It's okay to be skeptical, but you want them to have the best information that you can provide them. And there's lots of resources you can direct people to where they can get good information. But just starting those conversations can start making a difference. And then specifically about the mitigation, that message about the health co-benefits is really important. The more that people understand that reducing emissions from our tailpipes, reducing emissions from point sources, making our buildings more energy efficient will save us money, will improve our health, will be a message that's really important because we will see benefits in the short term that will be so beneficial to so many of us that we should, as I said, really start mitigating for our health and focus on those health benefits.
Thank
So
you.
what do you do on an individual level? So the one thing I always recommend, and I don't know your communities, but look around and see where you can volunteer your time on something of importance to you. In Seattle, we live in King County, and King County every other year has the Green Globe Awards. And they are so inspiring. They give out about a dozen awards every other year to individuals, communities. The last time, one of the tribes won for all the work they've been doing on cleaning up one of the rivers. You've got people who are advocating on climate change, people who are working on energy efficiency. And there's all of these opportunities to get out and work with people who've got similar concerns and really work on something you've got passion for. And that can make a real difference locally, and eventually, of course, it'll make a real difference globally, because every action we take matters. Every action to reduce our greenhouse gas emissions is going to be beneficial. So I encourage people to go out and find places where you can engage, and then think also about how you can set an example of biking when you can. You don't have to take a car. If you can bike, if you can walk, you can take a bus. Finding ways to show that there's lots of very positive changes we can make in our lives that reduce our emissions and are good for all. And I should say that there's lots of NGOs that will give you long lists of things that you can do. When Steve Chu was head of the Department of Energy, he liked to go around to college campuses. And one message he always had was, put your computer to sleep if you're not using it. That our appliances use 20% of all the electricity they'll ever use when they're in standby mode. Just put your computer to sleep. You don't have to shut it off, put it to sleep. We all know about the chargers for our cell phones are called vampires because they keep drawing energy even after your phone is charged. You can pay attention to those little things and they'll make a difference to how much electricity you use, and then of course how much greenhouse gases are emitted. We've got a question from Lewis about the poison ivy. It's a good question. There is a little bit of work in this area. There's essentially no funding. So there was a little bit of work on one of the major drugs that's used for malaria, comes from the plant wormwood. And actually that's increasing with climate change. That I mentioned there's this particular mechanism for plants through photosynthesis to bring carbon in. And what happens is you're seeing an increase in the carbon in the plants and a decrease in nitrogen. So overall, you see an increase in the carbon-based molecules and a decrease in the nitrogen-based molecules. And so thinking about what's in the plant, then you can start looking at the shifts. This is often, I don't know, people often like hearing about this on college campuses for some reason. But one of the carbon-based molecules in plants is the active ingredient in marijuana. And the carbon growers understand that carbon dioxide increases the concentration of this compound. So my understanding is the marijuana growers have been growing marijuana under higher CO2 conditions for quite some time. And someone told me that one of the consequences is that the marijuana sold today has about 10 times as much active ingredient in it as a concentration of marijuana sold, I don't know, in the 60s and 70s. So there's been a real increase in that concentration, which is something that people should probably pay attention to if they decide they're going to be smoking marijuana, because it's a lot more potent. It's a direct consequence of CO2. Louis, did that answer the question? I see that you, okay. I don't see any, oh, one new question came in. So the question is, how to convince people to timely issue? Unfortunately, the weather is convincing everybody it's a timely issue. If you start talking with people about how the weather has changed, for us in the Pacific Northwest, that heat dome was really massive. It's a very progressive area. We've been working on climate change a long time. Really concerned a lot of people. The flooding that's happened this year and last year, just all of the changes that are going on have been visible to all. And starting from what people are seeing literally in their own backyard is a great place to start, because people will tell you that things are different. If people watch birds, they can talk about changes in bird migration patterns. If you like the butterflies, there's been issues with the monarch butterflies. There's so many changes going on in our natural systems. And starting from that perspective gives you a solid basis for a discussion.
So you had, oh, I'm going to ask another question. So you had, you showed a chart where you had talked about stunting in children increasing and it being directly related with wheat production, I think it was. Is that a prediction based on wheat production, or is it based on something else?
I'm not sure I understand the question. So that was for wheat.
Okay, so the stunting is based on food insecurity.
Oh, sorry. So the stunting in particular was based on overall reduction in calories. But as I said before, 85% of calories around the world come from wheat and rice. So it's based on overall reduction in cereal crop calories.
And then I have one other question, if I can ask it. Okay, so there's been a lot of work looking at the cost of the extreme conditions and what happens in them. I haven't really seen a lot on the cost of, and you did show a little bit of it, but okay, so maybe there are so many other changes taking place due to climate change. They might not be these extreme ones, but they're costly too, especially when you add it up over time. Has there been a lot done on that?
There's been a little bit done on that. And it's been done from the perspective for the negotiations of estimating the costs of adaptation. And when looking at the costs of adaptation for health, most of them focus 2030, 2050, and are really incredibly simplistic. Basically assuming the world doesn't change, it just gets warmer. So in 2050, we're all the same age, you're all in the same classroom. We haven't done anything different to the world, it's just gotten hotter. And the estimates overall are tens of billions of dollars a year to manage the additional cases of malaria, diarrheal disease, food insecurity. And we know if you start changing the world, you start adding more people to it, you start thinking about the other interactions you mentioned earlier with our ecosystems, that's a significant underestimate of how much the costs could be. You can look at what the world's paying right now for COVID. And so we know that we really are underestimating those costs, and they're still in the tens of billions of dollars a year.
And one more, sorry.
Sure.
So this is based on just because of, I know my own frustration what's the right thing to do. And I know we have to do a little bit of everything that we can. But when we're looking at the big picture of fossil fuels versus electricity versus, you know, everything else, I struggle a little bit, like, because I think that there's this concept that once we switch from fossil fuels to electricity, we're not consuming any, you know, we're not producing any more CO2 and it's all good. But, you know, not only are we still producing CO2, but then we have all those, the batteries and everything like that. So what do you tell somebody who is struggling with that? And why can't we have, like, I know we still have to have batteries, but why can't we just switch to solar powered vehicles?
It's a great question, and we definitely need technology development. And there's been a lot of investments in technology development. Boy, if we could get really great battery storage, it would be amazing. It's something that there's been a lot of emphasis on the last couple of years. I keep reading about all these possible improvements in batteries. So that would be just a terrific thing. From the biggest perspective, I think one of the most important changes that could be made worldwide is every year there's something like $3 trillion spent in subsidies for oil and gas and coal. It's just an astonishing number. That when you think about the major oil and gas companies around the world, they're some of the largest companies in the world. They used to be the largest companies before technology took over, and yet they receive immense subsidies. And if those subsidies were taken away, we would be in a different situation, because the costs of our renewable energy sources have come down significantly, and it's not a level playing field. So if we can have some technology improvements, if we can reduce those subsidies, then you'll see that we'll have a real shift to renewables. In the US, you can see we've had a real shift away from coal in the last couple of years because it's no longer economically viable, that there's been a switch to natural gas. So fix some of the problems we have with how our taxpayer dollar is spent in subsidizing oil, gas, and coal, and we would see a much more rapid shift. And of course, we need to do it in a way that we can make it more equitable. I can afford to have an electric vehicle, and I do. That's not an option for many people. We need to find ways to ensure that everybody can afford to switch to our green economy.
Thank you. Do we have any more?
Yeah.
But one more question.
Okay, there's one more question in the chat. Given the wide cultural differences across the globe, do you have any suggestions on how to communicate climate change related topics in a way that it is applicable across cultures?
I'm pretty fortunate I work in health. I'm even more fortunate that I've spent a lot of time in low and middle income countries, primarily working with ministries of health. There is no problem communicating climate change in hardly any country, except here. Occasionally in Australia, but people in low and middle income countries see the impacts of climate change. They're feeling them right now. It doesn't take any convincing. It's really inspiring to go. I've had the privilege of working in villages with the poorest of the poor. They're seeing it. They're willing to do just anything that they can. You come in and they want to know, what else can I do? I'm seeing all these changes around me. I want to feed my family. I want my family to grow up and be healthy. And so that really isn't much of an issue. The US is the most polarized on climate change as an issue. And it's a political issue. It's not a scientific issue. And there is lots that needs to be done to really have people pay attention to science. And this is not unique, unfortunately, to climate change. And yes, Climate Central is excellent. Climate Central's got great graphics. They've got lots of very useful information. I would also look at the 6 Americas, because it's named the 6 Americas because they've divided the US population into 6 categories, from the very, very skeptical to those who are terrified, and are working on communication approaches depending on which segment you're talking about. As people understand more about climate change, they're moving from there's a big group of I'm not sure into I'm definitely concerned, and making sure that they have information both about the risks and about the actions they can take is really important. And those are just 2 sources. There's lots of environmental NGOs that have got great information about communicating around climate change. And don't forget to look at our comedians. Most of our comedians put together these incredibly funny skits communicating around climate change. Jimmy Kimmel, for example, Colbert, others have great pieces that I use in my courses to talk about climate change because they're so effective.
Hey, great. Thank you so much. I guess we're out of time. We used up all your time. That was wonderful. We really, really appreciate this. I mean, you're doing such amazing work, and your message is really timely, and it's really reaching a lot of people and having a huge impact. So thank you very much.
Thank you for having me. Good luck with the rest of your seminar.
Dr. Heidi Hanson is the group leader of the Biostatistics and Multiscale Systems team within the Advanced Computing for Health Sciences Division at Oak Ridge National Laboratory. Dr. Hanson comes to ORNL from the University of Utah, where she is a demographer and life course epidemiologist with experience developing methods for population-based risk prediction. She investigates the genetic and environmental influences on health throughout the life course, focused on the discovery sphere of translational research. Please welcome Dr. Heidi Hanson.
Thank you for the introduction. So I am just a new transplant to ORNL. I come from Utah, and a lot of the results that I'll be presenting today are from my past work in Utah. Just to give you a little bit of background on my theoretical perspective and the way that I'm thinking about these questions. I am coming from a department of surgery where a lot of the focus was based on precision medicine. And a lot of precision medicine is based on omics and genomics. However, for many of the, many of the complex diseases or chronic diseases, environment plays a very big role. And so a lot of my research has been focused on how can we start thinking about bringing environment into what clinicians are thinking about when they are recommending health interventions and thinking about precision medicine. And then also, how can we take the information that we get from these types of studies and apply it to climate change types of questions so that we can activate political movement against some of the most egregious health disparities and exposures. So just to give you a little background, and I'm sure you went a little over this in the last presentation, so I won't go into it in great detail, but changes in climate are projected to affect air quality across the US, and these changes are also expected to affect mortality as well. Now, what I want to kind of point out is that many of the mortality projections are based on older adults. So among adults 30 to 99, you see projections among adults 50 to 99, and you also see the projections only calculating in diseases that affect older adults. So lung cancer, heart disease, and there's very good reason for this. There's just a wealth of evidence that air pollution and air quality affect these diseases. But what I'd like to focus on a little bit more today is other diseases that aren't thought about as much, and thinking about how climate change going forward might affect the population in ways that we haven't projected yet. And yes, I apologize. So the top line is the projection considering no reduced anthropogenic emissions, and the bottom line is if we do reduce emissions. And this is from a paper that was just recently published in the Journal for American Association, or JAMA. So as I talked about, a lot of my research is coming from Utah. And so I'm going to focus on many different diseases that aren't often considered in what the projections are. Sorry, I'm actually going to focus on 2 diseases, but there's a lot of research coming out of Utah that crosses many diseases. So the diseases highlighted in red are the ones that we actually the studies were done in Utah. So this is just kind of a summary of evidence out there of what are the actual effects of air emissions or pollutants on health. And you can see that it is far-reaching. We see children are affected, reproductive systems and reproductive intent is affected, heart disease, brain, skin, pancreas, and bone, and then more commonly cited are lung and heart. And you see that there are quite a few diseases here, and air pollution really affects the health of an individual. So the 2 diseases that I will actually be focusing on are cancer, and I'm going to expand it from not only cancer mortality, but complications after cancer diagnosis and treatment, and then also spontaneous pregnancy loss in my presentation. So why Utah? It's not only just a sample of convenience. I'm not picking Utah because I'm from Utah, but there is actually quite a not necessarily unique, but interesting air pollution events happen within Utah. So 80% of the population lives in what's called the Wasatch Front, and that is the map that's highlighted on the right side. You can see this is during what's called an inversion day. So many of the valleys in Utah are surrounded by mountains, and you can see this in the picture that is right here. This is Salt Lake Valley. A large percentage of the population lives here. These are the mountainous regions surrounding it. And what happens is on really cold days, cold air caps the valley, and air pollution is trapped below that air cap. And so air pollution levels get quite high during these inversion days. So if you look at the annual average of air pollution in Utah, you're going to see we look pretty healthy, because on most days we do. But in the wintertime, and now it's happening more during wildfire seasons, we have these inversion events and air becomes trapped within the valley, and we get very high levels of pollution over a short period of time. These traffic cam views are showing what the air pollution looks like on similar or same days across different points in the valley. And you will see that there's quite a bit of geographic variation on what's going on. And so we have both spatial variation and temporal variation in air pollution exposure, which is terrible from the population perspective, but makes for a very nice laboratory to look at the health effects of air pollution on a short-term basis. So this is just another couple of slides to kind of hammer home the idea that we have a lot of spatial and temporal variability. Most of what I'm going to be presenting today is going to focus on this area. This is the Wasatch Front, where most of the population of Utah lives. And you can see also has the heaviest level of air pollution. And these are the maximums for the year 2009 by zip code. And then temporally, again, you'll see overall, if you take the average PM 2.5 exposure in a year, we're going to look pretty good. But there are these days where there are very heavy air pollution exposure levels due to that inversion effect. And I've already mentioned that most of the population lives within this segment that we'll be focusing on for most of the day today. The other part that makes research in Utah about air pollution quite unique and very valuable is a database called the Utah Population Database. So the Utah Population Database began actually in the late 1970s, early 1980s by a group of demographers at the University of Utah. And at that time, they started to collect a lot of data on family history information for individuals. So they were able to get this information from the Utah Historical Society, and it's been supplemented with information from Ancestry. So we're able to build these very large pedigrees and look at family history of disease. Well, being demographers, they were interested in more than just family history of disease. There was a legislative mandate made that required all administrative data to be sent to the Utah Population Database to be linked to these pedigrees. So this includes birth certificates going back to 1905, from 1905 to the present, death certificates during the same time period, which allows us to see where people are born and die. And then in addition to that information being linked to these family histories for the entire state of Utah, we have information from the Utah Cancer Registry, which begins in 1966 in Utah. So that gives us a very rich resource for looking at an entire population's cancer risk. They have information on healthcare claims from the University of Utah and Intermountain Healthcare, which are the two biggest carriers in the state of Utah. They cover 85% of population. That's outpatient, inpatient records, ambulatory surgery records, and all of that information is linked to the demographic records that I was speaking about before. They also have statewide admissions for inpatient records, emergency department records, and those are linked as well. So we see essentially a statewide health trajectory of an individual from 1996 going forward. And then it's linked to voter registration records so that we can see where individuals are moving across their life course, driver's license records, again, so we can see where individuals are moving across the life course. So that what you can actually do is have a data set that's very rich and allows you to see where individuals are residing, what their exposures might be as early as birth, and then look at their health history later on in life. As you imagine, the data security here is a very, very big thing. So it takes quite a bit of approvals and a long process to get approval to use this data. And the data are kept on the VMs at the University of Utah. But if you are able to go through the process, it leads to a very rich resource for investigating environmental exposures and genetic factors that lead to disease all throughout the life course. So the first study that I'm going to present to you is looking at maternal fetal health. So essentially air pollution and pregnancy loss. And this is generally a very difficult thing to study, and there's certainly going to be bias in the results that I am going to show you today, and we'll discuss that. The way that we're getting information about the pregnancy loss is from the administrative claims records. So essentially, the pregnancy loss must have occurred during a time period where an individual would show or report to the doctor because of the pregnancy loss. So there's bias. We're not capturing miscarriages that happen very early on, or miscarriages that would result in an individual not going to see their practitioner after the miscarriage. But we are able to capture data for the entire Wasatch Front in a very, very systematic way. So we're not seeing biases based on which health system they're reporting to. And we are able to take advantage of the Utah environment where we have periods of very high exposure for short periods of time. And that's what you're seeing right here with this calendar. So these are monthly levels. Sorry, these are actually daily levels of PM 2.5 exposure. Green days are good, red days are bad. And you can see that there's quite a bit of temporal variability throughout the entire year. This is January to December. And so what we do, because it's very hard to get to causal statements when you're looking at something like a miscarriage in an administrative health record, but because we have this large temporal and spatial variability in air pollution, we're able to take advantage of something called a case crossover design. And this case crossover design allows us to get as close to a randomized controlled trial as we can with administrative data. Again, causality is not something we can say here, but it's very, very close, where we're comparing an individual to themselves on different days. So we look for an individual's risk for miscarriage on multiple days, and we control for same day of the week because people present, there is selection into when people present to doctors. So we do same day of the week as the actual event happened. So this red day is date of miscarriage. And then we compare the individual to themselves on other dates that they were at risk for a miscarriage. And this allows us to net out anything that we can't capture very well, because anything like socioeconomic status isn't going to change within a month's period of time. Your housing situation hopefully will not change within that short period of time. It's definitely possible, but we're controlling for all of these long-term time constant factors that generally confound the results between air pollution and a health event, and we're using an individual to compare to themselves. And that allows for a more powerful study design than normally. And what we find when we look at records from 2007 to 2015, this study was actually published in 2019. My student at the time is the first author, Claire Leiser, and did a great job on the analysis. And we find that individuals in the Wasatch Front, we had about 1,400 women that had a spontaneous pregnancy loss during that period of time that reported to the hospital. And we find that while there is the pattern of increased pregnancy loss with PM 2.5 exists, it never reaches statistical significance. We do find that a 7-day average in nitrous dioxide exposure increases risk for miscarriage. This was a study, this figure is taken from some of the press that was given to this study after it was released. But you see that the average nitrous dioxide level across the study was 35 micrograms per cubic meter. This is an average day. And the peak level is 145. And we find that a 20 microgram per cubic meter increase is associated with a 16% increase in the risk of miscarriage. And this is a linear association, so it's not a threshold effect. For every 20 micrograms per cubic meter of increase in nitrous dioxide exposure, you see another 16% rise in the risk for miscarriage. So that is the Utah study. There have been findings that have reproduced this association, not in the same exact way. This study takes a bit of a different approach to doing it, but they're also finding similar effects where they see an association between weekly nitrous dioxide levels over gestation and the change in the number of live births. And their assumption is that the miscarriage rate during that period of time increases. And this was reproduced in Boston and Tel Aviv in this study. So there is some evidence for an association between nitrous dioxide and miscarriage risk. There still needs to be more work done on this, but we're definitely seeing it reproduced across different locations and studies. So what does this mean for climate change and also future research? So one of the things that I've been thinking a lot about, and there are some people at Oak Ridge also thinking about these questions. Diksha Ragstoshi is one that is studying this, and Blair Christian is thinking about how this translates in our already known health disparities work. So there are known health disparities in rates of miscarriage and preterm birth and other other birth outcomes among racial and ethnic categories. And so what this is showing you, this is from another study that was done recently published, and it's showing you that exposure to traffic related or transportation related air pollution varies between races and ethnicities more than it does for household income, educational attainment, or age. You see quite large differences in exposure. We also know that there are differences in rates of miscarriage and preterm birth and low birth weight babies across races and ethnicities. And if if climate change affects certain populations in disparate ways. So climate change is not equally affecting the full population. Some of these disparities may increase over time. And this is just to show you that the disparities in pollution exist, and we know that there are health disparities between these things. It's also important to think at the global level. So this is from a paper that was published in 2020 looking at nitrous dioxide. And basically, I don't want to get into the details here, but the takeaway is, again, there are different geographic regions where this type of finding may have larger impact. We know that agriculture is driving nitrous dioxide emissions. And so thinking about ways that we can reduce nitrogen use in agriculture may be ways that we can reduce population exposure to nitrous dioxide and hopefully reduce some of these health effects, and that there are definitely global differences. And then this is just to show, based on different climate change projections, that nitrous dioxide is expected to increase over time, meaning, and again, more research needs to be done on this, but there may be increases in miscarriage that disproportionately affect populations that increase over time. So the next thing that I would like to talk about is childhood and young adult health, and I'm talking in the specific context of cancer. So what I'm going to walk you through here is a figure that my group has put together at Utah, and we put together this figure to kind of talk about air pollution in a different way than people are normally used to thinking about air pollution and cancer risk. So there's quite a large amount of research that shows that air pollution exposure in cancer-free individuals increases the risk for cancer. I would say the evidence is very strong there. And in addition to increasing the risk for cancer, it also increases short-term and long-term clinical inflammation, which has cardiovascular effects, pulmonary effects, and many different other healthcare effects. And we see individuals coming in for asthma, COPD. So air pollution in cancer-free individuals is bad to overall health and also increases risk for cancer. But what is less thought about is how air pollution affects both cancer treatment and how the known cardiopulmonary toxic effects of cancer treatment can interact with air pollution exposure to lead to even more severe health effects in an already vulnerable population. So what my group has been doing is studying the effects of air pollution exposure during pre-cancer treatment, during cancer treatment, and after cancer treatment, so that we can start looking at the individual's health from a more holistic view, not just a single point in time. How does pollution lead to cancer incidence? But not only how does pollution lead to cancer incidence, but response to treatment after cancer has been diagnosed, adverse health effects related to treatment after cancer has been diagnosed, and then survival during the period of cancer, after cancer diagnosis. And so the story here is really much more complex. And again, if we're thinking about this from the lens of health disparities, we know that individuals who are lower socioeconomic status of different racial ethnic minorities generally have higher risk or higher exposure to pollution pre-cancer diagnosis. So if we know pollution leads to cancer, increased risk for cancer, those individuals are already at a detriment because they're at increased risk for cancer due to their air pollution exposure. But then when they return home after cancer diagnosis, they're generally living in the same environment. So if that pollution exposure continues to affect health after diagnosis, they're in a continually increased level of exposure and may have even more adverse health effects related to air pollution exposure over time. So the first results that I'm going to show you, I'm not going to go into details on all of the background and everything, but you're welcome to ask me questions about the study design, is we take the data from the Utah Population Database. Again, we have cancer diagnoses for the entire population from 1966 going forward. We actually trim this down to a smaller subset of individuals because we have very good health records related to visits to the doctor, inpatient records, emergency department records from 1996 going forward. So what we actually do is we trim the cohort to 1989, and we look at pediatric cancer mortality, adolescent and young adult cancer mortality related to increases in PM 2.5. And we find that there are increased risk for mortality related to air pollution exposure, PM 2.5 exposure. So we do find an increased risk for mortality for pediatric cancer patients with lymphomas. This is neuro cancers, and then lymphoid leukemias. And we see an increase in risk for mortality across all of those cancers for pediatric patients. And then we also see similar effects for adolescent and young adult cancer patients. So we see that there's increased risk for cancers, for multiple different types of cancers and PM 2.5 exposure. We do find that for some of these cancers, PM 2.5 exposure is protective, which may be a sign that something about the place is leading to this, and something that we may want to consider on further investigations going forward as well. But we do see these significant associations between PM 2.5 exposure and increases in cancer mortality. And just to describe this for you, I apologize, I should have done it on the last slide, but what you're looking at is compared to an individual with cancer and lower PM 2.5 exposure, an individual with a 5 microgram per meter cubed increase in PM 2.5 exposure is at approximately a 20% increased risk for cancer mortality at the 10-year post-diagnosis level if they have colorectal cancer, and at 5-year survival levels, they're at approximately a 30% increase in risk if they have colorectal cancer. And this again is a linear effect, so there's not a threshold in what I'm showing you. We're showing that per 5 micrograms per meter cubed, that there is a 30% increased risk in mortality for these individuals. This is when you're looking at a threshold effect. So this is anything that's over 12 micrograms per meter cubed. And you see that there is a definite, this just helps with interpretability. So if you want to say, okay, if any individual with cancer and they're an adolescent and young adult is exposed to greater than 12 micrograms per meter cubed of PM 2.5, they're going to have a 20% increased risk in mortality at 5 years and 10 years. And these are significant. And then you see these associations for melanoma, breast, and colon cancer as well. And you see that the results show for all-cause mortality as well. So this is mortality directly related to the cancer, and this is mortality related to some other cause that's not necessarily related to the cancer. And we also see that there is an effect modification by census tract socioeconomic status, which again feeds into the story about health disparities that are related to socio-demographic factors. And we see that individuals who are in the lowest socioeconomic status census tracts are at even more increased risk compared to those who are at higher levels of socioeconomic status. So this is a penalty just for the lowest socioeconomic status. It's not a linear effect, but there's definitely an increased risk on top of the PM 2.5, or the PM 2.5 exposure is even more detrimental in lower socioeconomic status areas than in higher socioeconomic status areas. And not only does the mortality, do the cancer risks, not only does the air pollution affect cancer mortality after diagnosis, but we also see that it's affecting respiratory hospitalizations for childhood cancer survivors. So individuals who are cancer-free in our population, we're able to look at how often they report to the hospital with a respiratory infection on a bad air day. And this is what this this, oh, sorry, this is what this dot is right here. It's showing there's no significant increase for cancer-free individuals in the number of reporting days to the hospital for cancer-free individuals. We see cancer survivors with no chemotherapy, so they would not have had the same cardiotoxic effects or pulmonary toxic effects of chemotherapy. We know that chemotherapy can damage the heart and the lungs, making individuals more sensitive to air pollution exposure on bad days. So if they have not been treated with chemotherapy, there's not a significant increase in risk of reporting to the hospital with a respiratory condition. But cancer survivors with chemotherapy, treated with chemotherapy, do have about a 2 times increased risk in reporting to the hospital on a bad air day. And then we also see a similar type of pattern, although not statistically significant, for respiratory infections. So the take-home story from the cancer results is essentially air pollution has adverse effects, not only leading to increased risk for cancer, but also increased risk of mortality and increased risk for other respiratory, and I'm not showing some of the cardiovascular effects that we found, but respiratory and cardiovascular adverse outcomes during and after the treatment period. And this is work that is brand new, and my group and others are working on studying this question in more detail. So what does this mean for what do these findings mean for future research and with the future of climate change? So this is from the article that I referenced early on that was published in JAMA in 2021. These are the projected changes in annual average PM 2.5 concentrations from 2030 to 2095 with different climate change models. And what I want the take home to be from this figure is that there are big differences in how these changes are going to affect the population of the United States. They're not evenly distributed across the United States, but we see very big hotspots of increased PM 2.5, especially across this southern belt region, where they're projected large increases in PM 2.5 exposure over time. And these increases pretty much overlay with what we know to be disparities in cancer incidence as well. So this is a map of cancer incidence rates. And again, I'm focusing on the younger population because these are the populations that often aren't included in projected effects of climate change. But these are the cancer incidence rates by county for all cancer sites for individuals under the age of 50. So they generally fit into that childhood, adolescent, young adult population that I just spoke about. And we do see that where areas that have high levels of PM 2.5 increase over time already have high incidences of childhood and adolescent young adult cancers. And so it's this double hit effect where we already know that there are known disparities, but as climate continues to change going forward, there are going to be populations that may be hit harder by the adverse effects of air pollution and leading to increases in health disparities over time. And these are just different sources of US mortality from PM 2.5. This was a study published in PNAS in 2019. And again, the basic takeaway from this study is there are many different sources. Wildfire is a big source of PM 2.5 exposure and mortality. And that is only projected to increase with climate change, and that's going to affect different populations in different ways. And that we also see that there are large disparities, not only in who's emitting the pollution, but who's actually using the goods that are leading to those emissions. And we know that there's less usage in goods that are leading to the emissions by the populations that are hardest hit by the adverse effects of climate change going forward. And then I would just like to acknowledge a lot of this work has been done by many different people. We've worked in a very collaborative nature and continue to work in a very collaborative nature going forward. I'm very excited to be at Oak Ridge because it allows me to incorporate more input from climate scientists. And I'm excited for the projects that we will be able to have going forward. And thank you for your time, and I will take any questions now.
Oh, thank you very much. That was awesome. We do have one comment from Alexa in the chat.
So in animal production systems, dairy farms have a great record keeping regarding conception, early embryonic death, abortion, stillbirths, etc. While there are obviously a lot of factors that contribute to individuals' farm reproductive stats over the course of a year, it would be interesting to see if this data might correlate in any significant way with human reproductive data. That is absolutely fascinating, and I think that would be a fantastic study, especially because, as I mentioned before, it's very hard to study some of these things, especially miscarriage, because there's selection into the actual events that we see, which means our results may have some bias to them, and it's a bias that we can't really control for statistically very well. So actually looking in animal populations to see if we see similar things would be fantastic and provide even more evidence toward the effect. So that is a fantastic idea. If anyone wants to pursue it, I think it would be great, and it will be something that I will keep in mind as well. And
that Dr. McCourt could help you with that, because she is our new One Health veterinarian. So she's based in Nashville.
Well, I would absolutely love a collaboration on that. So Dr. McCourt, if I will look for you and email you a follow-up email, and perhaps we can chat about possibilities for collaboration going forward. So the next talk is how exactly will climate change lead to worsening air quality? So there are lots of different ways that it is leading to worse air quality, and it's kind of a web of causation, right? So all of the factors that lead to increased air pollution also lead to increased climate change. And we know that without putting some sort of cap or dampening on some of those things that are going on, they're going to be increasing together. So there's causation. Will have more heat events, more severe weather events. Those heat events can lead to changes in air pollution, air mixing, can increase air pollution. In the case of Utah, let's say, some of the extreme cold days or extreme heat days will change our air pollution exposure because of that cap or that inversion event. So we can already see things happening with changes in the way that we normally experience air pollution in our population. But that I would say there are many different ways that it leads to it. And it's not only direct climate change directly leading to increased air pollution, but all of the factors that lead to climate change also are associated with, many of the factors that lead to climate change are also associated with increased air pollution.
I have a question while we're waiting. I guess there's more coming in, but you had listed several body conditions, body systems that are impacted by climate change and by air quality specifically. And one, for example, you mentioned pancreas with insulin resistance. Is that likely a direct result of inhaling bad air, or is it maybe stress related as well, which is still, all related to it? But can you talk about how those were listed?
Yeah, absolutely. So it's really important when you're thinking about the associations between air pollution and health outcomes to think about what are the biological processes that are possibly leading to this. And there are many different biological processes. So you can have the direct effects where there's some sort of biological link to the particle being lodged within the lung, and that leading to some sort of adverse health effects. So particles being lodged in the lung and leading to increased exposures to certain chemicals or whatever the chemical mixture is in that particle, inflammation. And then there are the indirect effects where you can have things like increases in stress, increases in kind of baseline levels of stress for long periods of time. And there are multiple biological processes going on, and the biological processes affect the different health systems differently. So when a researcher is putting together a study, it's very important to think, okay, why do I think this is happening? What are the underlying biological processes that could be leading to this observed association? And kind of trying to tease those out. At an epidemiological level, we can't answer those questions directly, but that's where some of the animal studies come in, and there are more biospecimens that we are able to capture that might allow us to look at some of these things from more of a direct effect and get more insight into exactly what's going on. So for example, the University of Utah has been storing cord blood for a long period of time. So we can take cord blood from mothers who have actually given birth, look at biomarkers that might be related to both increased inflammation or other things going on that are related to that air pollution exposure, and determine or investigate what a biological link may be. But there are many different both direct and indirect ways that air pollution exposure can affect health, and how it's affecting certain organs is dependent on what those direct or indirect effects may be.
Awesome, thank you. And I believe there's one from Dr. Gross in the chat.
So there are hosts of other toxic impacts that might be enhanced by climate change. I am not aware of a review. So if you are aware of a review of them, I would love to see that, and would be very, very happy if you sent it my way. I can also take a look at the literature as well, but I think that's a very great comment, and something that I will definitely look into as I do my research going forward.
Thanks, Annette. Dr. Gross, are you aware of a review?
Okay. I wasn't able to unmute before. Thanks, Heidi. That was a great summary. Yeah, I was just going to respond. So there's a NIEHS has been sponsoring committees through the National Academies on a variety of topics. I don't think there's been a workshop specifically on climate change impacts on toxicants, but I need to go back. I haven't been on that committee in a long time. That's one place I would look, but if they haven't, that would be a great thing for you to suggest, Heidi.
Yeah, I agree with you. I actually like that idea quite a bit. And so I will do a little bit more research on whether or not it has been done. And if it hasn't, I will suggest that and potentially reach out to you as well if you're interested.
Well, Heidi, you may not know, but there is an institute that produces what's called the Risk Assessment Information System. That's between UT and RNL, and that's part of the staff report to me.
Okay.
And it's all on chemical and radiological risk, but we don't do anything about climate. It's all based upon EPA sort of guidelines at current. So it's something I think is worth doing. Let's put it that way.
Okay. Yeah, thank you. I did not know. I'm just brand new, a little over a month that I've been here. So I appreciate you letting me know about it, and I'll definitely look into it.
I'll throw a link into the chat on that.
Okay. Thank
Sure.
you.
Yeah.
Awesome. And I think we've used up our time. So thank you so much. You've got two good collaborations now moving forward.
Yeah, that's fantastic. It's the best part about doing presentations. So thank you very much for your interest, and I'm excited to work with you all going forward.
Dr. Richard Hamelin is a professor in the Department of Forest and Conservation Sciences at the University of British Columbia. He has 30 years of experience in forest health research and has published over 160 peer-reviewed scientific articles. His research aims at improving our understanding of disease outbreaks, selecting resistant trees, and developing tools for detection and monitoring of pathogens and pests. He was president of the Canadian Phytopathological Society and the Quebec Society for Plant Protection. Dr. Hamelin was awarded the Fellowship of the American Phytopathological Society, the Scientific Achievement Award of the International Union of Forest Research Organization, the Queen Elizabeth II Diamond Jubilee Award, merit awards from Natural Resources Canada, the Canadian Forest Service, the Canadian Food Inspection Agency, and the Quebec Society for Plant Protection for his pioneering work on the application of genomics in forest protection. Please welcome Dr. Richard Hamelin.
Again, thank you. Thank you so much for the invitation. And too bad I could not be there in person. I was really tempted, but still a little bit nervous about getting on a plane to cross the continent. I'm in Vancouver right now, and but I'm super excited about this initiative, actually, this One Health initiative, and about this this session. I've been thinking about this One Health initiative, and I've talked to people about it, and it's actually the first time I give a talk on it, like a formal talk. So I'm really delighted to be able to share with you my views on how healthy forest, for a healthy planet, can be part of a One Health initiative. So first of all, maybe other speakers have said this, but One Health is not a new concept. Hippocrates had talked about this or written about this 2,000 years ago. The idea that public health was dependent on what he called clean environment, but it was very much an anthropocentric view of the One Health, and even I went to the CDC website, and even the CDC, it's One Health is much about humans not getting infected from animals, and when they talk about deforestation, it's more in the context of human can catch more disease, with deforestation because of insects, mosquitoes transmitting human diseases and so on. So today I want to give you a flavor for a couple of things. Well, first of all, some of the, I want to tell you about some of the benefits that forests give to human and the planet and animals, by the way. But also, I want to show you how many parallels there are in what we do in plant pathology and forest pathology and human health, especially during the days of COVID. I see a lot of that is being published and goes on the media that I'm thinking, hey, they're similar to what we deal with in terms of problems. Let's see here. Okay, so well, let me tell you about forests. An amazing resource. About 30% of the Earth is covered by forest, and it should be no surprise that these forests are in places such as in the northern hemisphere, where the boreal forest, the temperate forests are occupying huge areas. And then, of course, the tropical forests is where most of the forests are concentrated. The forests tend to be concentrated in like some big countries, Russia, Canada, US, Brazil, but even China. Actually, China is is one of the top 5, and amongst those, there's about 50% of the forests of the world are in those 5 countries. And it's great. I just heard yesterday at the COP26 meeting that these countries and others agreed to stop deforestation by 2030. So excellent news for the forest people and the planet, of course. So what else is great about the forest? So forests actually, they harbor incredible biodiversity from, forest trees. There's 60,000 different species of forest trees in, in the world forest. There's something like 70,000 species of vertebrates. There's 400,000 species of plants. And then, over 1.5 million or so species of fungi and invertebrates. So a huge amount of diversity. And that's probably just scratching the surface. I'm not even talking about bacteria and all these other things. Really, just a great haven for biodiversity is present in the forest and conserved. Well, one of the major things that forests and trees do is this amazing reaction, photosynthesis, by which plants and trees capture the sunlight, the sun energy, and take up CO2, carbon dioxide. That's the worst or the most important greenhouse gas. And then through transforming the light energy into chemical energy, they can then transform these carbon dioxide into sugars, and then eventually molecules like cellulose and hemicellulose that they can store in their stems, in their in their woody cells, basically in their stems, in their branches, in their leaves, and in their roots. And on top of that, as a bonus, a byproduct of this reaction is oxygen. So what a great reaction for the planet, taking out these greenhouse gases, spitting out some oxygen for animals like human and other animals and living organisms that require oxygen for respiration. Some people make calculations. I'm going to show you a few of those. They're always kind of fun to look at, but some people did calculated like a single tree, average tree. Okay, so average tree fixes 25 kilograms of carbon per year. So if you multiply that by 40 years, this adds up to 1 ton of sequestered carbon. So that's a significant amount. That's just the average tree, right? The old growth that we have here in British Columbia, or the humongous 70-meter trees in the Amazon forest. You can probably multiply that by 10 or 100. So great ecosystem service here that the trees and the forests provide. And I think we all know this, but it's good to remind ourselves that trees are great natural air conditioners. And we all know this. And when there's a heat wave, we've had one of the worst heat waves in British Columbia ever, actually. And there was 3 days in a row in Vancouver, a place where 25 degrees Celsius is usually considered hot. We had 3 days in a row of 40 degrees. And the little town of Lytton in northern BC had 49 degrees 3 days in a row. Amazing heat. And trees, well, they cool down the environment, micro environment 5 to 10 degrees. And we all know this. You're in a city and it's hot, and you always look for the shade of the trees. And again, some people did some kind of funny calculations. So a tree provides the equivalent of 10 air conditioning units running 20 hours a day, while at the same time taking out the greenhouse gases and spitting out oxygen. So this is really important for cities. This whole area now that's called urban forestry is really big on this. Cities want to, green up the cities to get rid of this urban heat effect. These kind of hot pockets because of all the concrete and the pavement in cities. Trying to cool down their cities. Well, of course, trees also clean the air. So the trees and forests are great natural air filters. They remove particulate matters just by catching it in our foliage. There's a lot of surface area where the particle in suspension pollutants are just kind of deposited and get stuck on the leaves and then eventually fall down to the ground, but they're sitting taken out of the air. They also take up gaseous air pollution via stomata, those little stomata that you can see here, little openings in the leaves, open and close, and they can take up some of those gaseous air pollution on the leaf surface. And again, some people crank up numbers. And someone measured actually in the United States, they removed, the trees removed 170 million tons of pollutants in 1 year in the US alone. And they did some projection. They said that it prevented the incidence of respiratory health issues, 670,000 people, and valued that at $7 billion. So kind of a fun numbers. Also, there's a city in France, Strasbourg, one of my favorite cities in Europe. Strasbourg, they calculated also that there was something like 88 million tons taken out of particles in the air and pollutants in a single year. So it's significant. And this is a really hot area of research, the how trees and forests improve people's health. And there's been multiple studies in a lot of them are actually in medical journals, trying to measure get some metrics, get some numbers on how trees improve. It's easy to say, but let's get data. And this one study I'll tell you about is, I'm telling you about this because it's in the city of Toronto in Canada. And this study shows that the higher tree density was correlated with a higher perception of health. So people felt better or felt healthier where there were more trees, but also it translated into real numbers in terms of the incidence of heart disease and metabolic disease. So it seems to be not just a perception, but also real benefits. And the authors of this paper calculated that if you plant 10 or more trees per city block, that would be the equivalent of saving more than $10,000 per household in health-related costs. I don't know what you're thinking. I'm in Canada, healthcare is free. That's probably what you're thinking, but it's actually not free. Someone pays for it, the government, and actually our taxes pay for it. So this number is actually legit. Well, the reverse is true. This is a very cool study if you like insects that attack trees and to look at their impact. So the emerald ash borer, of course, in the Northeast, it's been one of the worst invasive species. It attacks and kills ash trees, really kind of hard to detect. It keeps moving really quickly. It's all the way up now to Quebec City and New Brunswick, and so. And this study, actually published in the medical journal, looked at counties that had intense emerald ash borer or no emerald ash borer activity. And what they found is that there was an increase in mortality related to cardiovascular and lower respiratory tract illnesses in counties infested with the emerald ash borer. And the borer was associated with an additional, more than 6,000 deaths. It's not nothing. Wow, this is huge. Related to illnesses of the lower respiratory system, another 15,000 plus cardiovascular related deaths. So these, what I said before about trees improve your health and all that, but when the trees die, it just has the reverse effect. It really worsened, people's health outcomes. Well, green space is also good for your mental health. Not only it takes out, the trees, take out CO2 and pollutant from the atmosphere, and they improve your health, but also good for your mental health. I love hugging a tree, even if they're too big for me. Whenever I go in the woods with my wife, we make sure we hug some trees. Makes you feel better. But there's actually some studies that show the benefit of this. And this is a study, actually, PNAS, that was published. The work was done in Denmark. It's published in PNAS. And they found that there's a lower risk of psychiatric disorders later in life when children were more exposed to green spaces. And they found that if children were raised in low green space environment, then that increases their risk of mental illness by 55%. So these are big numbers, and that early in life. So there's another study that shows that there's an increase in urban trees that's correlated with lower antidepressant prescription rates. So really, this all has to do with trees and forests and parks improving your mental health. So, I mean, let's sum it up then. Forests are great and trees are great. They make our lives better. They take pollutants and greenhouse gases out of the atmosphere, spit out some oxygen. They're good for your health, physical and mental. There's, nothing's wrong with this picture. This is too good to be true. And just me and my wife, we just love nature. We just love to go in the, hiking, and it just, it just makes our lives better, honestly. All right, but there's a cloud on the horizon. That's what I want to tell you about now. So we live in this age of the Anthropocene. That's the era during which one animal species, Homo sapiens, has taken over the control of the planet and is changing the planet in ways that seem to be irreversible. And that threatens our forests. And there are, I'm going to talk about some of the worst things that humans do to forests. Almost every forest health issue, like severe forest health issue, I can relate to one of those three factors. First is invasive species, so species that come from elsewhere and take advantage of an empty niche or the absence of predators or competitors or hosts without any resistance. The other one is climate change. We know that climate change is increasing tree stress, losing their needles earlier, early frost. There's all these climate change impact that are stressing trees, and that's going to promote some pathogens, and some pathogens are going to kind of take advantage out of that. The last thing is tree domestication. I mean, basically we're cutting trees and then we replanting, but we don't replant the diversity of trees that we took out. In BC, I mean, most of what we plant is pine, fir, spruce, that's pretty much 90% of what we plant. So everything else, we kind of, it's not going to make money, so we're not keen on planting them. So that's reducing the species diversity. Also, we tend to plant genetically improved material, which reduces the genetic diversity. So basically, overall, that increases the homogeneity. So these are some of the issues that I will tell you about in the coming minutes. So globalization, talking about invasive species, globalization is responsible for the rise in the number of forest alien invasive species. And these graphs here, they're kind of amazing. On the right is the air routes. Pre-COVID, of course, I'm not sure if it's as busy now, but this is pre-COVID. You can see that their planet has become a very, very small place with these hubs of people going every day. Planes go back and forth amongst continents. And we saw during COVID how quickly a virus could go around the world. I mean, it took a couple of days, basically, before the virus, was, from Asia to Europe and then to North America. So that's one of the issues, this globalization, the planet being a very small place. The one on the left is kind of cool too. All you see is the continents, because everything else are marine routes. So the shipping. And you can see that it's busy, you know, and that's why is it busy? Well, that's because we sit at home and we have our iPhones and we order on Amazon, and then, you know, someone in China has to, you know, put ships, you know, containers on ships, and these ships go across the ocean, and, you know, so that we can get the little toys, whatever that we ordered. And that's the new reality. These ships go back and forth every day. And so all of that made the planet, you know, a smaller place. And why is this related to invasive species? Well, a couple of reasons. First of all, these shipping containers, they look like this, but inside are all these boxes, crates, pieces of wood that attach the boxes and so on. And this tends to be a great source for invasive species. You know, people take like cheap wood, and they'll, you know, they'll make these boxes, you know, basically for no cost. And some of the cheap wood is can be infested with pests and pathogens. And that's one of the big problems with the shipping. So things like Asian longhorn beetle, for example, that we have in the Northeast, came through wood packing material. Even last year or 2 years ago, we found one larvae in a crate in Edmonton, in the city of Edmonton, came by train somewhere. So this is a big way, an important way that insects can be carried around. And of course, in these galleries, it can be pathogens as well. But the other big source of invasive species are what we call plants for plantings or live plants. You know, you go to the nursery, you want to buy some trees for your garden, have some nice landscaping, and you're not looking for the regular pine or fir. You know, you want something exotic, right? And well, that's what probably 99.99% of what these nurseries produce are sort of exotic trees and plants. And these plants travel. I mean, these plants go places, and sometimes the plants themselves, sometimes the plant with the soil, sometimes just cuttings, but for sure they get around. The problem is that in the needles, in the leaves, in the buds, in the branches, in the roots, in the soil, can be some hidden pathogens that would be asymptomatic. They don't show up in the nursery, but as soon as you plant the trees, little planting stress, you know, less fungicides, and then these pathogens can pop up. So that's one of the big ways where plant pathogens can get around. And of course, once that happens, it's really hard to put the genie back in the bottle. And there's, you know, too many examples of invasive species. I'm only going to talk about this one here, but white pine blister rust is one of those pathogens that we accidentally imported. And the story is kind of sad because it's in the 1850s in the Northeast of North America, we had cut so much of the white pines that we realized that we need to start planting. But we had no facilities to produce seedlings. So what did we do? We just packed seeds and shipped it to Germany, France, Holland, Sweden, and they produced seedlings, and then we imported the seedlings. And of course, with the seedlings came this terrible pathogen, white pine blister rust, that since has devastated the white pines in North America. And not only the economical value of white pine, but also now the ecosystem value of white pine, because here in the West, the white pines play a keystone role in the alpine ecosystems, high elevation ecosystems, and their role is as important as preventing erosion, providing microenvironment, providing food for the nutcrackers, the grizzly bear, you know, the white bark pine has been really hammered by like a triple whammer of white pine blister rust that prevents the regeneration, mountain pine beetle that kills the adults, and then climate change that pushes the trees higher and higher. So this is really a species that's been threatened, and the starting point of that was the white pine blister rust that we accidentally introduced. So I would like to tell you a little bit about the sudden oak death, because I felt like, you know, during the COVID outbreak, I was working on a paper on sudden oak death, and I saw so many parallels in what we were doing in sudden oak death. And, you know, my wife works in medical research, and like we were sort of comparing notes, and it's like, hey, you know, we did the same thing. So I want to tell you more about this. Now, the sudden oak death, one of the similarities is that in the 1990s, it was not a disease, no one has ever heard of it. It was not in any textbook. It had never been described, and then it showed up. Then it showed up in California. People started seeing, you know, dead oak trees. And then this pathogen was isolated. And then the same year, it was described in Europe. So, and then all of a sudden, it was all over Europe. So similar to COVID, it was this moment of like, wow, okay, this disease it's all over the place. It's already spread everywhere. So the pathogen is actually, it's kind of a funny pathogen because it you know, we call it sudden oak death because it kills oak trees, but really it can attack 200 different host species, plant, you know, trees, bushes, rhododendrons, camellia, roses, you name it. It can probably attack it. So you know, it's not limited, but it cannot actually, so, you know, it can jump from host to host, and that's the problem. In some of the hosts, like bay laurel, for example, that they have in California and Oregon, the damage caused by the pathogen is very light, just little leaf blotches, you know. But the pathogen produces abundant spores, and those spores go to the oak tree, infect the oak trees, and kill the oak trees. So this, you know, again, I'm drawing a parallel with some of those animal reservoir. It's really these additional hosts provide a reservoir, and then the final host, the one that gets killed, is different from the one where it, you know, where it originated. So like COVID, we've also, you know, used some of the genomics approaches. We can't sequence as many genomes as the coronavirus, but still, you know, the capacity to sequence genome has really increased, and it allows us to do some really cool things in the sense, you know, it allows us to identify sources and pathways, look for variants, and look for traits, you know, that we can predict in terms of pathogenicity, adaptation, host specificity, that kind of things, and then develop tools for surveillance. So let me tell you some of the results that we found. So again, we sequenced more than 500 sudden oak death Phytophthora ramorum genome, which is a large number for it's a eukaryote organism. Don't forget, you know, it's not a virus, so it's got a genome that's relatively small compared to the ones of trees or plants, but it's still 65 million base pairs. So it's not a tiny genome, but it's not a huge one either. And the results are, you know, a little bit as we expected. So this pathogen comprises variants. We call them lineages, but they're really variants. And the surprise was that these variants are quite different from one another. And actually, between the two most distant lineages, we calculated about 1 million years of divergence. So these lineages have been around for a long time and diverging and doing whatever they were doing before we noticed them. And maybe importantly, the variants have different characteristics. This is just a picture, a graph of the growth. You can see that there's quite a different growth pattern in these lineages. And of course, we have a UK variant. There's another parallel to COVID. There's a UK variant, but we described the UK variant before COVID was a thing in humans. So we have precedence here. And some of those lineages are geographically constrained. I'm going to go more about that in a minute, and others are widespread. Now, think about this UK variant. What happened is like, this pathogen keeps surprising us. It keeps kind of throwing things that we didn't expect, So in 2010, the pathogen was found killing larch in plantations in the UK. Millions of larch trees were either killed or had to be destroyed before they could spread. And the big thing that was surprising to us, two big things. First of all, is the first time that this pathogen attacked a conifer. So before that, it was only deciduous trees, but for all of a sudden, it was attacking and killing conifers, which, like from Canadian perspective, is like, ouch, because we've got a lot of conifers in our boreal forest. So that was a big problem. The other thing is the pathogen changed a little bit its epidemiology. I told you earlier that, there was a reservoir that produces spores. Spores attack the oak trees, but the pathogen does not sporulate on the oak trees. Now here on larch, the pathogen attacks the larch, causes cankers, sporulates on the larch, and then can go to attack the next larch. So it can really develop into these big local and regional outbreaks that way. Okay, I told you about these variants that are geographically constrained. It's kind of only partially true what I told you. So we have some North American variants, the NE1, NE2, NE1 very dominant in California, then NE2 more up on the coast, Oregon, Washington State, and that's what we have in BC as well. Is BC on it? Yeah, BC there. And EU1, the UK variant that I told you about, that's present only in Western Europe, in Brittany and United Kingdom. But then we have this EU1 variant, the kind of the widespread, sort of the Delta variant of sudden oak death that is present everywhere in Europe. We find it in North America, and there's a big problem with that, and that is these pathogens, they've been propagating only clonally so far, because it turns out that they have different mating types, and they need to have opposite mating type in order to cross and recombine and produce progenies. And they can't do that now because in North America, you only had the A2 mating type, so the NE1 could not mate with the NE2. Same in the UK, but when the EU1 started being introduced into North America, then all of a sudden there is that potential. And sure enough, that potential was just realized. And this is a paper we actually published yesterday in bioRxiv. Where we found the hybrid between two lineages, two variants of sudden oak death. So you can see this is a way to analyze the genomic data, the principal component analysis that reduces complex data set to a couple or three vectors. And you can see here that genetically, like all these NE2 cluster here, the NE2 is there, NE1 is here, EU1 is here, and these little hybrids, they're right there, right in the middle between EU1 and NE2. And you can see on this phylogenetic network here, same thing, you get the NE2, EU1, and a hybrid right in the middle. And on this bar chart here on the right, you can see that, this is in the rows, you have the samples, and the color indicates assignment to a variant. So you can see that NA1 are all NA1, EU2 are all EU2, and then EU1 in green and NA2 in orange. And you see these guys here, these two hybrids, they're like half-half. And really, so they really look like F1, like first generation hybrids between those two variants. So we find that these variants are also very dynamic in a temporal way. We mapped it over time, and you can see that NA2, for example, was like, wow, really abundant early on, then kind of crashed in about 2009. Then you get this other variant, EU1, that's been on the rise. Now it's kind of crashing, but we'll see. That's stopped in 2017. We'll see what 2022 and before will show us. Certainly very dynamic situation. We conducting this what we call genomic biosurveillance of sudden oak death. Basically, when they find new samples, we sequence their genome, analyze them, try to cluster them, construct these haplotype network to see the relationship and abundance. So each circle is a haplotype, like a genetic combination. And then the little branches are like the number of mutations that accumulated. And you can see there's a pattern here, because in blue, it's pre-2010. Remember what I showed you here, 2010. So this is pre-2010, and this is post-2010, and that's in the EU1 variant. So it looks like there's been a shift here with possibly like an expansion of one of those variants. And we think, well, it could have been a super spreader event because this picture here shows in the rows the nursery. So each row is a different nursery, and here are the years. Here each column is a year, and you can see that early on in the outbreak here you had all these different variants, but they kind of gone, with one little exception here. They're kind of gone. They don't show up at all. But from 2010 on, it's this blue variant. Okay, this is the one here. Sorry about the color; it should have been red. But there's this variant that's abundant, and it's like a swarm. It's found in so many nurseries. So it looks like it could have been a super spreader event with replacement of the current variants, a little bit like the Delta variant replaced, the other Alpha and so on variants. So again, very similar to the COVID situation. We are now at the stage where we have great tools for detection, monitoring, surveillance of these of pathogens such as sudden oak death. PCR has been great because, as I told you earlier, the pathogen can spread without us seeing symptoms. So they can be completely hidden in foliage or in the roots or in the stems. And PCR allows us to detect the pathogen even if we see no symptoms. So that's been fantastic. Now, again, thanks to the capacity, pretty much driven by the human health sector, we now can sequence for a fraction of the cost the whole genome of these pathogens and gather all this information. Things I haven't talked about, but that's certainly super important, eDNA metabarcoding in sort of a warning surveillance system. So that really great promises for developing tools for monitoring the invasive species. So this pathogen surveillance to increase preparedness, I think it's the way to go. The idea would be that you get your your samples, whether it's a bug or any kind of forest enemies, get some genomic data, upload it on the cloud, and then you have some kind of assignment. It's lineage EU2 in North America, big red flag going up, and then you can map it. And in my ideal world, this would be real time and open source, so that if I find something here in BC, In Tennessee, you should be able to have access to that. If you find something, you should be able to query my data so that you can say, hey, I have the same as your NE2 variant or something like that. So that's kind of my vision for the future. A little bit copied on the GSID database for COVID again. Okay, I'm going to switch gears for a little bit here because I want to tell you about climate change, a hot topic, and something that we really need to have much more on our radar screen. So the premise is that we know that tree populations are adapted to past rather than current or future abiotic and biotic conditions. I mean, some trees have been growing for 80, 100 years. Back then, we just took seeds, put them in the ground. We know that the climate's going to change. So this is the current map of BC on the left, with the average temperatures. And you can see that a lot more hot colors in 2050. That's just in 2050, okay? So if you think 2075, 2100, it's going to get even worse and worse. So smartly, BC has changed its seed selection protocols. Before, they used to plant seeds that are locally adapted. But now we know that the seeds that are locally adapted are going to be the wrong genetic material for 50 to 100 years. So they are doing a climate-based seed transfer. So we're trying to figure out what's going to be the climate in 2050 or 2075, and can we match the seeds to that future climate instead of the current plant climate? Kind of cool thing. So we have a project where I work together with the breeders, but of course I'm a pathologist, so I look at the disease angles, and basically what I tell them is that, well, some pathogens are going to be winners in this climate change lottery. So you might, move your trees around, but the pathogens will come, or they're already there and you don't know it. Or some of them, given the right climatic factors, precipitation, temperature, going to change their life cycle, increase sporulation, increase infection, with the consequence of disease that you're going to have increased severity. So that's already happening. We have unprecedented outbreaks of tree diseases. Swiss needle cast is what I'm showing you now. We've had big seasons, the last 3 or 4 seasons. This season is really, really big. This is a pathogen that attacks Douglas fir, one of the favorite coastal tree species. And the pathogen is actually growing endophytically. That means inside of the needles. And it's not really trying to kill the host, but when it comes out in the spring, it puts in a fruiting body in the stomate. So it goes into the stomate, comes out through the stomate, puts a fruiting body, blocks the stomate. And that's a problem for the trees. It basically kind of chokes the tree, prevents gas exchange, so it cannot take CO2 and spit out O2 anymore. A problem with evapotranspiration. And so the trees then kind of lose their needles. That's why it's called a needle cast, casting their needles. And then they kind of look naked like this. This is a tree that's definitely, you should barely see the sky. Douglas fir like this on the ground, I mean, I should barely see the sky. And yet here you can see how sparse it is. We cut down that tree and you can see that you can't see, but let me tell you, because I saw it, that the last 10 years of growth rings are basically tiny. It's basically the tree stopped growing. It's just kind of a survival mode. And there's a couple of more diseases. So what can we do about that? Well, one of the things that we've been pretty good at in forestry is exploiting natural resistance in trees. And this is something that, I laugh with my wife who works in medical health, and because she says, you're so lucky, you can kill all those trees. If I want to do a screening test, I can kill 10,000 trees, and if 5 survive, and go like, okay, these are the survivors. No need for ethics forum or for, any kind of committee the consent form or ethics committee or any of that. So that's one of the pluses of working in forestry and plant pathology in general. So, but this way you could basically pepper these pines with the pathogen and see who's a survivor. And the survivor likely has some resistance mechanism. As it turns out, something that we've learned over the years, the last few decades have been really productive in this area of research, especially working on model systems like the plant Arabidopsis. That's one of the favorites. And what we found is that, well, there's an immune system. So there's actually a pattern recognition receptors in plants that can recognize patterns in pathogens like the chitin. Chitin is present in the cell wall of fungi, and this can trigger a defense response on the host, prevent infection. Now, of course, some of the pathogens have developed like these special structures, like these Hostoria, where they can start pumping some effectors that can disarm the response of the host, and of course, then the pathogen can produce another type of effector that will overcome that. And there's a type of receptors called NBS-LR receptors that people are very excited about, that can recognize the effector and then take out the effector. So those are legitimate resistant genes that can trigger a defense response or prevent infection. And so a lot of this has been done in Arabidopsis, cool stuff. In trees, almost nothing. I mean, we know so little of this on trees. What we know is that the resistance is there. This is white pine blisteros, for example. The necrotic spots here on the needles is a hypersensitive response. Is a response by which the tree recognizes the rust pathogen and kills its own cells so that to trap the pathogen inside the dead cell. So we know it's there. The problem is, I think it's not a problem, is that the exciting thing is to be able to exploit more of the findings of Arabidopsis and apply that to trees in the future. I think that's where we need to go. But for now, we still use the old-fashioned selecting pines for resistance to blight because we plant so many lodgepole pine in BC. So the breeders told us, okay, we need to be resistant to Dodystrophy needle blight. So again, we can kill all those trees, see who survives, and we've done a pretty good job at that. So we've identified some resistant families. The problem, as often with these kind of resistance, natural resistance, is there's a trade-off, because it's not good for a tree or plant to constantly defend themselves if there's no pathogen. So there's always some kind of a trade-off. Well, it turns out that there's a really, really strong latitudinal gradient in resistance to the pathogen in lodgepole pine. You look at the latitude here between 50, that's about Vancouver-ish, to 60 way north, near Alaska. And you can see how the pathogen is much more resistant. So disease level much lower in higher latitude, and then the susceptibility goes up at lower latitude. That kind of makes sense because the disease is more severe up north. So the pines have probably co-evolved, resistance in their population, and they can resist and tolerate better than in the south, where the disease is not really a problem. So there's been no co-evolution. The problem, of course, is that once we want to do assisted migration, remember I told you about this climate-based seed transfer. Essentially, what we want to do there, we want to take southern seeds and plant them in the north. And that's going to be bad news, because southern seeds are not susceptible, not resistant, they're susceptible, they're not resistant. And we're going to plant them in an area where there's a lot of pathogen. So that's something we need to take into account. So we can't just move material. We have to take into account these biotic agent as well as the abiotic agent. It's a complicated equation. So I couldn't not talk about the Wood Wide Web because Suzanne Simard, author of Finding the Mother Tree, is my colleague, and she's in my department. And we've done some work together. We published a paper just a couple of years ago on this. Of course, her idea is trees interconnected, and they can, shuttle resources from tree to tree and from mother tree to seedlings and so on and so forth. But there's also something very practical in this, looking at looking at the roots in the microbiome. And we've done a study with Suzanne where we looked at the microbiome of Douglas fir and birch. Now, Douglas fir is very susceptible to root disease. Birch is much more resistant. And we looked at their microbiomes, and they're quite different. But when we grew them together in a mixed plantation, turns out that the Douglas fir microbiome starts looking like the birch microbiome. So it's remarkable how much the Douglas fir microbiome kind of picks up the birch microbiome, and it doesn't look at all like a Douglas fir microbiome anymore. So we think that there's some real potential there of intermixing, increasing resilience, just via taking advantage of microbiomes of the different tree species. We never thought about that before. We thought about some kind of allochemical interactions maybe, but like it seems to be the microbiome doing that. So I think, again, just scratching the surface here in forestry, but microbiomes, phytobiomes of trees, definitely a topic of the future. There's a lot of promises there. All right, so kind of wrapping it up here, and I'm glad that the COP26, they announced that the 10 of the biggest countries, including Canada, US, Russia, China, Brazil, signed an agreement that they will stop deforestation by 2030. That's coming soon. I'm excited about that. And so we do need to protect our forests, to plant more trees. With everything that I've said, with trees providing all these ecosystem services benefits, improving our health, fixing greenhouse gas, we have to plant more and protect our forests, but we need to do it in a smart way. We can't just go and plant trees out there that are going to be dead in 20 years because we didn't think it through. Trees grows for centuries, so we need to make sure that we're doing it right, and especially with regard to future climate change, and also with regard to biotic disturbance agents. So we need to get much more aggressive with this monitoring and surveillance to ensure the health. We tend to plant trees and forget about them, but we need to really pay more attention. And sort of circling back to where I started, so trees, animals, and human health, it has a lot in common. I think I showed you that some of the patterns, some of the variants, some of the movement, some of the genome sequencing to learn about the movement, even learning about the immune system, and about the microbiome. There's a lot that we can learn from each other, and especially that now in the era of genomics, we share platforms, we share type of analyses. I work with my son who's also doing bioinformatics on COVID, and he gives me his scripts that I can use on my sudden or death genomes. So there's a lot that we can share, and especially in terms of platforms and analyses. But there's also some challenges. So one of them, and I'm just listing the ones that just came to my mind, but one of them is certainly stakeholders, different stakeholders in forestry, certainly vet and medicine. And I've been to meetings where we were trying to do this, but you can tell that vets and medical health, human health have more in common than forestry, plant pathology, agriculture, food production. I mean, that it's just a little bit difficult to mesh with the vets and the medical. stakeholders. The other thing is funders. I mean, it's maybe stupid, but NSF and IIH, here we have NSERC and SHIRC, and we applied completely different funding sources. There are some programs, some multidisciplinary, but they're more the exceptions, and they tend to be sort of these big, overwhelming projects. So, but that's that's an issue. Also, language. Little things that we call differently, and I'm thinking just virulence, for example. Like, it means something different for a plant pathologist than an animal pathologist. And so these are some of the little things that that could be challenging. And this was my last slide, and I'd like to thank you. This is one of my favorite places for hiking. It's called the Lions, two little mountains. They look like lion's ears. Actually, you see them from downtown Vancouver, where my apartment is, and in 30 minutes I can just whip up there and do a nice hike. So it's kind of a nice place to live and connect with nature. So thank you very much. I'm very happy to have more discussions with you.
Thank you so much. That was great. And I want to emphasize that it's important for us to mesh. We've got to be working together to try to solve some of these issues. I know we have some questions coming in. I would like to start off, though, by just asking you, how do we stop some of this? Because clean trade in wildlife, clean trade is a huge issue. How do we come up with clean trade? Because even if we're looking for certain pathogens, we're missing so many. And we don't really have a good way, we don't have a good surveillance system. So in plants, especially with some of the not the crop, the non-egg plants, have a similar issue, right, with clean trade? I mean, what are your thoughts on that?
Yeah, that's a big question, the clean trade. So we have, for example, I mean, the big challenge is the not being able to see the pathogen in these asymptomatic infections. So you can have an infection, you don't see it, so the inspectors are not gonna see, they're gonna see green tissues, and it's gonna get a green light. Some some people advocate complete stopping of trading. I mean, I know that in the UK, well, after Brexit, I think they're thinking now they can do it. They can say, no plant from the continent. So I know that there some of them are talking about that. In terms of the what you can do, so Canada and the US, we have a special agreement though, because the plants are not inspected. Well, maybe they're a little bit inspected, but they can cross the border much more easily because the countries agree on protocols to certify the health of the plants before they cross the border, so that you don't sort of slow things down at the border. Basically, you just do it in your own country, and you show the certificate, and then you go across. Some people think that's not a good idea because obviously we've been, carrying a lot of stuff between Canada and the US, but how to do it, some of the molecular approaches maybe, but you will never be able to test everything. That's the thing. It's just the volume is just so humongous that testing everything is impossible. I'm sorry, I don't have a very encouraging answer, but trade is a big problem, and there's not that many solutions. In some cases, well, I shouldn't say that, because there's actually some success stories with with the wood packing material, with the crates and everything that's wood. There's an agreement now, and all shipping countries signed the agreement. It's called the ISPM 13 or 15, I can't remember, which requires the wood packing material to be treated, either fumigated or heated to kill any living organism in there. So for wood, it's a relatively easy. Well, it's relatively easy. It's the enforcement that's hard. I mean, it's easy to do, but it's the enforcement that's hard.
Okay, thank you. There are some questions. Alyssa, you want to read them? Or maybe you can read them in the chat too. There's a couple of questions.
Okay. Okay, from Danita. Hi, Danita. Question I have regarding mitigation of climate change, invasive pathogen, and the spread of these exotics. What can be done on a very big question to at least slow down this devastation beyond what we are trying to do? Okay, yeah, that's a big that's a big question. So I think certainly with regard to climate change, I think what we're doing now, this kind of climate-based seed transfer, so that at least you can reduce the stress on the trees. I mean, the climate, the climate change, I mean, of course, the more we plant trees, the more we're going to fix carbon and blah, blah, blah. That's sort of a given, but it's more sort of at the political level. But I think that, in terms of what we're going to plant, we need to make sure that the trees that we plant will be, will be resilient and to both abiotic and biotic factors, I think, for climate change. In some cases, we're going to have to, I mean, I think if you look at the map that I showed in BC, there's some areas that are going to become deserts, basically. We already have some deserts in BC, but it's just going to expand. And there's some areas now that are forested that are probably going to become desert. And maybe that's okay, because, Canada is one of those countries where, we might be able to expand our forest, actually. Trees will be able to grow in areas where they can't grow now. So that's, that could be one of the pluses. What we need to be make sure of is that they're not going to encounter sort of the wrong pathogen, because it's, they are migration events, basically. In some cases, we're thinking, or they are thinking, to plant species, tree species like Ponderosa pine, for example. Ponderosa pine is a tree that grows in much drier and hotter environment in our Okanagan Valley. And they're thinking of planting way more of those Ponderosa pine, going north, where again, in 50 years, the climate's going to be okay. But yeah, what pathogens will they encounter? That's what we're trying to work with them about. The invasive, I think the invasive, it's all about much better monitoring, having these, like now, I guess we have these projects where we have spore traps, so that you can have early warning. Because the thing is, the sudden oak death that showed up in California in the mid-1990s, the way that it was all over the place, we're thinking it must have been there for 20 years. Started in a small place. It could not have spread so widely in just a few years. So it must have been there for a couple of decades. So I think having sort of these early warning systems, spore traps, where you can go like, hey, we caught a spore of Phytophthora ramorum in Knoxville, we got to look, and then look, because the earlier you do your containment and eradication, the better chance you have. I mean, there's not that many, but there's a few success stories of eradication of an invasive species. Toronto with the Asian longhorn beetle is probably the most notable one, where they've gotten rid of it, and it cost only $25 million, although the city was yelling that this was a huge amount of money. it saves billions of dollars. Yeah, the trick is to get them early, I guess.
Awesome, thank you. Oh, there's one more question, I guess. A quick question, it looks like, Nina's.
Okay, are you working at all with some mathematical modelers on forest health from an epidemiological perspective? Yeah, actually, we have another paper that's going to come out where we actually do that. We look at species distribution models, and we try to integrate the genomics because of the variants. So we know that some of the variants are, better adapted to drier conditions, some of them more like the coastal, wetter conditions. And we've modeled the increase in incidence of the Swiss needle cast, because that's one of the ones that's that's the most worrisome for people on the coast growing Douglas fir. And we've put together maps of different climate change scenarios in the future, and then with the two lineages or the two variants, with putting in their characteristics so that we can see if a variant is going to take over and replace the other. But certainly modeling is huge. We don't do enough of it, I feel, and there's a reason for that. The entomologists tend to do a lot more modeling than the pathologists, and there's a very kind of an almost stupid reason for that, and that is entomologists can count. They can count entry holes, exit holes, pupae, larvae, eggs. And that's a lot easier to model. Pathogens, it's kind of hard. They filamentous, and they produce spores, and it's not always easy to get the sort of that raw data for the modeling. But certainly it's something we need to do more of.
I think it's the same for the animal pathologists. It's hard to model it. I think it's because we think more, I don't know, abstractly or from an artistic point of view than the numbers. But
yeah.
All right, well, thank you very much. That was an awesome talk. Yeah, we're at the end of our time for that, and we really appreciate you sharing this. It was so wonderful to hear everything.
So we're going to have a panel discussion today on climate change and One Health. And the way that the panel will unfold is that each panelist has a slide where they will introduce themselves and then tell you about their work. Then they also have 5 questions that they've been asked to reflect upon, and we will answer those questions after you have a chance to talk about your slides. We also have some questions that were submitted at the time of registration that our panelists haven't heard yet, so we'll have a good opportunity to just brainstorm and dialogue around the issue of climate change. And then if there are additional questions that come up in the chat towards the end, then we will also respond to those. So without further ado, we'll pull up the first slide. And I think it's in order of Dr. Gus Engman. Is that correct? Yes. Great. And Dr. Engman has yep, there you go.
All right, well, good afternoon, everyone. Again, Dr. Gus Engman, and I'm a relatively new assistant professor in the Department of Forestry, Wildlife, and Fisheries. And so I've been here just over a year. It's been real interesting to start your career as a professor through COVID. And so I think it's appropriate, given that we're in this talking about One Health here. And so primarily my research is focused throughout my career is focused on anthropogenic impacts to aquatic ecosystems and aquatic ecosystem health. And I've got, three kind of drivers that I've focused on. up there, dams and associated human water use, extraction of water, urbanization, and climate change. And, I study how all three of these impacts and their interactions affect aquatic habitats. And then in turn, I've focused largely on studying fish communities and the biotic interactions. So kind of how all these things interact as in my career focus. And studying fish communities is a really good way to understand aquatic ecosystem health, because we often use them as indicators of overall aquatic ecosystem health. They're relatively long-lived, so they tend to integrate impacts, things like pollution that might happen in a moment's time through their lives. And they're also really important for human health, if you think about just in terms of recreational fishing, for kind of the mental health and physical aspects. I should mention that I mostly study freshwater fishes. And so freshwater fishes are really important for food security in a lot of areas of the world, and provide a lot of important micronutrients. Like some places, people get vitamin A is like a really important thing from fish eyes, where people actually eat fish whole. And then I've also done some research on how fishes could potentially impact human health in a negative way through studying contaminants contained in fish tissues, things like mercury. And so, I think that they all kind of are connected. And again, one of the things that I've really studied with in terms of climate change is how precipitation patterns are changing, both also with temperature, but primarily precipitation patterns, and how that again interacts with things like dams and human water use, and how that could potentially be a threat in the future. And so, but since coming to UT, I've actually kind of expanded my research into new areas and started studying freshwater mussels, which has been really exciting. And I'm working with Dr. Michelle Dennis, who's here in the room today, from the College of Veterinary Medicine. And we have a project studying, we're trying to understand these mass mortalities of freshwater mussels that are happening in the Clinch River, which is like a global biodiversity hotspot for freshwater mussels. And freshwater mussels are extremely important for aquatic ecosystem health. And the cool catchphrase we like to use for them is to call them the livers of the river, because they're filter feeders, and so they'll filter out pollutants and they'll clean the water. So it's a really important ecosystem service. But the Clinch River has many mussel species, but it also has some of the most imperiled mussel species, and there's some mass mortalities going on. And so our project is studying how the interaction of possible climate drivers and a potential disease driver in causing those mortalities. So it's been exciting to be here, and I think that's all I got for now.
Thank you. Now we have Dr. Kate Evans.
Thank you.
Yes.
Thanks for the opportunity to let me speak on this panel. This is my first hybrid meeting, which is weird, but we'll make it work. I am now a science manager, so I'm not doing as much science as I used to, but I'll tell you what I have been doing and where I'm still connecting. So I'm currently division director for the Computational Sciences and Engineering Division. The benefit of this is that we do computational sciences across many areas. So we include health sciences, materials, chemistry, earth, all the different sort of sciences that use high performance computing at Oak Ridge in there. And so I get to see interdisciplinary connections. So for example, connecting health with climate change, with urban sciences and transportation, and all the different things that you could think of when you're talking about these kinds of problems. So that has been one benefit of being over sort of a multidisciplinary science area. So my background is to study large scale weather systems, how they form, how they decay, how well we characterize them, and then also looking at numerical methods. In other words, to make these models more accurate at scale. So when we run these models with very high resolution at the scales that we need to look at things like health impacts, looking at how to make those models faster and more accurate. And in doing so, then moving more into sort of validation of models. How do we know that the model is creating the best data that we can, the most accurate data, and how well do we know the answer? So if you're a fisheries professor, for example, you want to know how accurate is that climate data that he's getting from us? How much uncertainty do we have? And so how well can we characterize what's going on? Where can I use it? That sort of thing. So connecting to other places there. And then so obviously that creates interesting science for climate impacts. So taking our climate model data and weather model data and using that for things like the health of people, say during wildfires. I'll let Josh talk about that more. Things like how people, how they're doing in cities, and particularly during weather extremes. So the picture lower right of my slide, I'm sort of turned around here, shows how the apparent temperature has been increasing. So not only has the temperature been going up during climate change, but also the humidity. And during health extremes, that's very taxing on the human body to have to deal with heat and humidity. And so studying that at the scales where we can look at things sort of at a county or city level is really important for health impacts. Also looking at things like energy use, how the power usage and the type of power that we use will change. And then also working with folks like at NIMBIOS to look at disease propagation. And, if you have more rain in one area, how will diseases propagate differently and things like that. So using that climate data at high resolution to look at the impacts such as health and other things. I think that does it. Thank you so much.
Thank you. That's wonderful. Exciting. And the next presenter we have is Dr. Christina Kinziger.
Hi, thank you for inviting me to be on this panel. I am an assistant professor in the Department of Public Health. This is my 6th year, so I have been here for a while. I come to UT from public health practice, actually. So I worked for the Florida Department of Health for a number of years with the Environmental Public Health Tracking Program and the Building Resilience Against Climate Effects program, both CDC funded projects that were being done in Florida. And I continue to work with them on a regular basis in the realm of environmental health. I'm an environmental epidemiologist. My research focuses on the impacts of climate on human health and disaster epidemiology, so natural and biological disasters. Because I have that academic and practice relationship there, a lot of my research is focused on evidence-based practice. So how can I, as a researcher, help improve public health practice, public health preparedness? So a lot of my current research is focused around that research to practice area. And so some of the things that I am interested in are understanding the vulnerabilities and the current and future disease burden associated with climate change. So understanding what makes some of our populations more socially, more medically vulnerable to the impacts of climate change and other disasters. And then understanding, how weather and climate are currently impacting human health, as well as based on climate projections, what we can expect in the future to better help our policymaking and our public health planning and preparedness activities. Also, looking at methods for developing stable and reliable sub-county indicators for some of our environmental health drivers, some of the health outcomes associated with negative environmental impacts, life expectancy, things like that. And then finally looking at better ways to measure at the micro scale human environment interactions. So some of my current projects are related to improving public health preparedness to some of these events by incorporating interdisciplinary methods from people. I'm collaborating with engineers and some colleagues in nursing to develop engineering-based models to help improve rural health-related preparedness for biologic and natural disasters. Also have a project funded with colleagues in geography and in social work looking at the urban heat island and specific vulnerable populations related to that, such as those who are underhoused or experiencing homelessness. And I continue to consult with Florida Department of Health and other practitioners for helping them, incorporate climate science and climate models into public health practice, because it's, those fields are very different, and sometimes it's hard to incorporate the different types of data that we have in both fields and to make it into a useful framework. Thank you.
Thank you, Dr. Kinziger. Is that right? Kinziger. All right. And next we have Dr. Joshua Fu.
My name is Dr. Joshua Fu. I'm a professor in civil environmental engineering. My primary starting my study is water quality and air quality, and now later on is climate change, all link each other. So my currently mainly two directions. One is to improve or reduce uncertainty of the climate model, which is introduce the chemistry interactions into the Earth system models. This is one of my directions. Another direction is to the climate impacts, which is we utilize all the climate model and air quality model, water quality models to provide the details to the final resolutions. For instance, we can down to the 1 kilometer resolution for health effect study in Colorado. So this is one of the demands from the different communities, from water resources, water quality, and human health. Need to have a fine resolution data. And how we gonna get there? This is a very challenging. From the currently this week is a COP26 in Glasgow, England. I mean UK. So this is the one of we trying to our best to reach the better quality of data to provide the different communities. And also, I serve the World Meteorological Organization's new initiative called the Model Measurement Fusion for Total Global Atmospheric Depositions. This is very important for the following 20 years study, because that will impact to the water and the food communities, and which is a very largest challenge in this century. Also, I developed the integration and the hybrid approaches for the AI and artificial intelligence and the machine learnings, and how to utilize those the data, the huge data set like a petascale data sets, how to find out those useful and better quality to provide the communities to use those data for their assessment. And also I work on another direction, like I say, the climate change impacts on energy infrastructures. We utilize a fine resolution for the energy power grids infrastructures study when the extreme event coming in, like hurricanes. So we did some case study in Katrina's cases in New Orleans areas. And also for the heat wave, flood and drought, I would like to emphasize the heat waves. Currently, we find out the ticks is brewing because heat waves. So it causes all the pets or animals and then transmitted to the human's health. This is one of the study is ongoing. Also, as I said, this first I focus on is to improve the climate. So we developed the chemistry solvers into the Earth system models. This is maybe the field study on that. So we are going to improve the Earth system model as a more complex interactions from the chemistry reactions in the atmosphere. The last one is I present this very important the future directions in the National Academy of Science, Engineering, and Medicine last year, how to integrate engineering and the Earth systems science together. So we have a climate model, how we gonna transform those models results to the engineering, because engineering to get a solution or the strategies or the mitigation for the climate change impacts. So this is very important, the future direction, how to integrate the two huge community together. So we need to have a bridge between the two communities, so we can resolve or solve or mitigate climate change caused impacts. And then we can adapt or resilience. Even we can really solve our problem somehow to meet the net zero carbon emission in 2050s. This is one of the future directions. So these are what I think I have a lot of the things to say, but I will stop here. Thank you.
Thank you so much. And then finally, we have Dr. Sindhu Jagadama.
Well, thanks for this opportunity from UT One Health Initiative. I am so grateful for that opportunity. I am an assistant professor of soil science at UT Institute of Agriculture. I received my bachelor's degree in agricultural sciences from India and my master's and PhD in soil science from the Ohio State University. After that, I joined Oak Ridge National Lab as a postdoctoral researcher. I worked with Dr. Melanie Mays and Dr. Terry Hanson before joining UTIA in 2016. See, the overall goal of my research program is to promote sustainable soil management, to increase crop productivity, and also to mitigate climate change. So soil management is very important because world soils can store, actually it stores 2,500 billion tons of carbon, which is 3 times the amount of carbon atmosphere stores and also atmosphere contains, and also 2 times the amount of carbon vegetation stores. So it's a big deal. So we need to do whatever we can to keep that carbon in the soil in order to reduce the greenhouse gas emissions, thus to mitigate climate change. So to achieve this overarching goal, we have several focus areas in my research program. One is to actually assess soil health in terrestrial systems, in particular managed agroecosystems, heavily managed agroecosystems. So like how important human health is, soil's health is also very important. But testing soil health is not as straightforward as testing human health. So this is one focus area of my research program. And second, we consider soil as a system. So we wanted to understand how the soil component is interacting with the other components of the system, such as plants, microbes, climate, and environmental factors. So altogether, how these different components interact so that we can sequester more carbon in the soil, thus to improve the soil health. And also we are interested in the mechanisms behind the long-term sequestration of carbon in the soils. So in order to do that, we do some foundational research in my lab to actually quantify and characterize soil organic matter or soil organic carbon, as well as to understand its stability and its distribution in the soil and loss from the soil. So this research topic has far-reaching implications because based on how we manage our soil, it can be a blessing or it can be a curse to climate solutions. So finally, I wanted to emphasize that soil health is an integral component of One Health. We heard a lot about animal health, human health, forest health in the morning from different speakers. But I wanted to emphasize that soil is the basis for plant growth, thus for food production. So a healthy soil is very important for healthy food, and which can support a healthy human and healthy animals. That's all I have. Thank you.
Thank you very much. It's great to have all of you here. And we'll start now with the series of questions that you had in advance. And we'll just go straight down the line and then we'll alternate. So we'll start this time with Dr. Engman, and then the next question, I'll surprise you, but we'll start at the end with Dr. Jagadama. The first question is, what do you see as the largest threats of climate change, especially related to your individual research interests?
Okay. So this again is pretty specific to my research interests, but changing precipitation patterns are something that that I think about a lot, and it's especially in freshwater systems and rivers, it's extremely widespread. Pretty much all rivers in the world are expected to have changes to what we call their flow regime, which is kind of an intuitive term. It's the kind of pattern of how much water is flowing through that river over time. And so, it's really widespread, and it's somewhat hard to control. It's not like, with temperature in streams, we can mitigate that directly to some extent with things like riparian shading or something. You might plant trees to shade the stream. And so, these changes in droughts and floods are a really large issue. And you can think about how that could, even on the landscape, these changes in droughts would cause things like fires, and that could have down impacts to freshwater systems. And then there's also, especially when you're concerned about droughts, or there's this sort of feedback with some of the other drivers that I study, where if we're in a time where we're scarce on water, people are going to win. Again, I think a lot about aquatic communities, and so if we're scarce on drinking water, then we're always going to prioritize people having that water over the fish or the bugs in the streams. And so think about how this could, there's all kinds of impacts to life histories and interactions with communities and in streams. But think about the kind of the One Health thing is that when, especially in the case of drought or even floods, when animals are stressed because of these changes in precipitation patterns and changes in flow patterns, they might become more susceptible to other stressors, to things like disease. And there's lots of other factors, things like changes in the algal community composition can impact the entire water quality of the stream. And that might happen, again, because of these changes in precipitation patterns. So that's something I think about.
So can I ask you a little follow-up, Dr. Engman? So what would you say is the largest of all of that you just shared? Which one keeps you up at night? Which is the one that is the most concerning to you?
Well, like I said, just changes to precipitation patterns, but I mean, I guess, these places that are experiencing these extreme droughts really, really worry me, because, like, for example, the Colorado River already doesn't flow all the way to the ocean anymore. And so that's a huge change, because we take out so much water for agriculture, and I mean, that can really, obviously, if a stream runs out of water, it's not a stream anymore, right? And so that really worries me, those droughts.
Thank you so much.
Yeah.
Yes. So we'll just go down the line. Thanks.
I could say he stole my answer, because I'm going to talk about not fish, but heat waves. So from a meteorological perspective, the biggest event that hurts people's health is actually heat waves. I mean, we see that a lot of the press goes to tornadoes and hurricanes and storms, but in fact, these large domes of hot air, which happen because of changes in the large scale weather patterns that happen. When you think about global warming, the greenhouse effect insulates the earth. It makes it more uniform in temperature. And so that changes the flow patterns that go around the earth. And so that changes these big weather systems that come in and how long they stick around. And so when you talk about these long droughts, we know that that's going to change going forward. And we have to understand, are they going to last longer? Will they be more humid, less humid? And that has huge impacts for human health, as well as the food that they eat and the plants that grow. So
thank you
for that.
Well, she stole my answer.
Speaking of heat, right.
Speaking of heat, yes.
Because I learned a new term with you, this urban heat island you mentioned. Yes.
Yes. Okay. So well, if we look at like the biggest direct impacts on like mortality, it would be storms that you mentioned, and precipitation type events like flooding. But the runner up to that is heat. And I would argue that heat also has a bigger impact on a more indirect pathway to human health. And that's through, not only just heat related illness, but also cardiovascular impacts, renal impacts, things like that, and even mental health impacts. And so So I would argue that heat is the one that keeps me up at night. We are seeing increasing temperatures globally, and then we also have this urban heat island effect, which is basically where urban areas are experiencing higher temperatures than the surrounding rural areas because of our impervious surfaces, because of less green space and things like that in the city. And so, and also just the air can get trapped. There's not as much, breeze, or depending on, where the urban area is. And so our vulnerable populations in the cities, in inner cities with, lower income housing, homeless populations, they are going to experience heat very differently than people that live in our newer buildings that have better cooling and infrastructure and have better capabilities of adapting to heat. So that is one of the things that we're looking at.
Yes, thank you so much. Yeah, appreciate that. I also love to see people of different disciplines nodding when somebody else says something like, "Oh yeah, that's really true." Yeah, I saw a lot of that. Dr. Fu.
I can add that the heat islands, especially for the low-income people, and all the they cannot pay the energy bills, especially the COVID-19. And this year, actually, we have a heat wave in Europe, and last year too. So we can have a more frequent heat waves. Those cause the heat islands problems, and those low-income people, well, one is cannot pay the bills, even they have air conditioning. So air conditioning, well, less usage. So that causes their, public health, human health. So they will go to the, one is like they have accessibility to the hospital or the clinic. So this causes a lot of problems because of climate change. And earlier, we just published one paper earlier this year. We looked at the 2050, the middle of the centuries, how the climate change impact to the urban areas, which is in the buildings. So I just talk about the low-income people. How about the general public? It will cause those efficiency of the HVAC systems, how to adapt the climate change in the caused by the urban heat islands. So this is what you have maybe pay more bills. So this is what energy and power grids impacts those how the demand and supply. And because before is going up gradually and now it's going down. So how are those utility company to how to deal with those allocation of their powers. So this is the one cause the problems. But another problem, recent study find out the rural area people. We talk about just urban, right? We talk about rural area peoples. And those people's accessibility to the hospital is not as same as in the urban areas, people living in the urban area. So they have accessibility because of climate change and cause that, like heat waves as well. So these are all the problems. It's gradually to spread different communities, no matter what levels of your income levels. So these are widely to impact our human with wealthy, healthy life. So this is one I would like to add. Yeah.
Thank you. And how about soil?
As an agricultural scientist, I am actually worried about the impact of climate change on agricultural sector in particular, both globally and locally. The mean increase in mean annual temperatures and also occurrence of more frequent and severe extreme events like drought and flood, it can decrease the crop production and also the livestock production. So, so the statistics show that 60% of the world population depend on agriculture for living. So this impact, this negative impact can directly affect the 60% of the population. And it can also affect the other 40% in terms of shortage of high quality food. and also increase in food prices. So, I worry about this occurrence of more frequent and intense extreme events. And we experienced this a few months ago because we have a organic grain production field experiment here in East Tennessee. So it was my first year, our first year of the experiment. We had a good crop stand in May and June. And then in July, we did not have any rainfall. So that water stress during that critical growth stage of the crop, heavily damaged the crop. And soon after that, there was this intense rain for more than a week. So that brought in a lot of pests and disease problems. So, it's our organic system, so we can't control those issues with pesticides or other chemicals. So, we had a complete crop failure. So, I was talking to a producer near Nashville. He also grows corn and soybean organically. He had a complete crop failure too. So these kind of this is real, and we see locally, and we talk about the global implication, but we see around us. So this actually concerns me.
Okay, so hang on to the microphone, and we're going to switch it up. So after you answer, you get to choose the next person on the panel to go. Okay, so you answer, and then you give the microphone to who you want to answer the next. Okay. Each of you will do that. So the next question is, what are the mitigation strategies that exist to prevent or slow the problems you are observing? So you've all shared problems. And so what is working, or what are you all working on to slow these problems from occurring?
Yeah, as a soil scientist, I wanted to emphasize what we can do to keep that 2,500 billion tons of carbon in the soil. So in the past, there was a lot of soil mismanagement. So you might have heard words like intensive tillage, over application of fertilizers and other chemicals. These practices actually caused a lot of soil degradation. So because of that, there was a lot of greenhouse gas emissions, and also that created, enhanced the climate change problems. So we can focus on soil-centric approaches to find solution for these problems. So these approaches include, these are natural approaches. These include like no tillage or reduced tillage, or growing cover crops during fallow season or when the main crop is not on the ground. So we can grow some cover crops. And also we can rotate several crops instead of growing one crop every year. And another option is to at least replace little bit of chemical fertilizers with organic sources. And also we can integrate crop and livestock farming together. With all these practices, we can definitely reduce the greenhouse gas emission and keep that, at least that 2,500 billion tons of carbon in the soil. Maybe we can add more. And I don't know how many of you heard that Tennessee is #1 in the nation for adopting no tillage. So our 80% of croplands are under no tillage. So it is #1. So that means that our producers are doing a good job in curbing these greenhouse gas emissions. But we are challenged with, the Tennessee and also the entire southern region is uniquely challenged with warm and humid climatic condition and also poor soil types. So we need to do more than just adopting no tillage to, deal with this problem and also to improve the soil health.
Thank you. Now who's next?
Kristie, right?
That's good.
Okay, so I thought a lot about how to answer this question, and I'm going to kind of not answer it. In public health, we deal more with adaptation than mitigation. And so adaptation is really focused more on how can we respond to the climate change that's already in the pipeline, we're already experiencing. So how can we reduce our vulnerabilities or increase our resilience? And so at the larger scale, I think one thing that public health can do and is doing is really focusing on improving our information systems and our early warning systems around the climate change impacts on human health. So we don't have, any really specific surveillance systems focused on most of our health outcomes associated with climate change, like injury, like heat-related illness. It's not, those are not like notifiable diseases. And so we are working with, hospital administration data sets and things like that to understand those types of health outcomes. But we are working more closely with our environmental information systems to try to start integrating those into one network, if you will. So like, for example, some of my colleagues around the country are introducing like air pollution data and climate data or weather data into their syndromic surveillance system so that they can monitor both the environmental impacts as well as what's happening, in our hospitals with chief complaint data. We also have public health practitioners around the country working with their National Weather Service offices to better understand what the local area thresholds are for the health impacts from heat and extreme temperatures, and understanding like the difference thresholds for the different types of vulnerabilities to the effects of heat. So elderly, children playing sports outside, the homeless are low-income housing populations that are affected by heat. So to better tailor our messaging and our communication to get the information out. And then on the more local level, we're implementing, evidence-based interventions and adaptation projects. One quick example, again, related to heat is I think New York City is doing this Be a Buddy program, having the local community work with experts in public health and climate change and weather to improve the community's resilience to the effects of heat and extreme temperatures. And the Be a Buddy aspect is, partnering with people that are more vulnerable to heat to help get them to the cooling centers or get them water when they need, or help them, pay their bills for their electricity to run their air conditioners when they need it, or their heating systems when they need it.
Thank you.
And I will
pass it to.
All right, thank you. She partially stole my answer, but also I have a couple options. We are thinking about like mitigation. Again, I'm just gonna stick with my precipitation theme and just say that we as humans can be so much more efficient with our water use. We irrigate fields, we just kind of spray it all over the place. Our default storage for water is like an open reservoir where there's all this evaporation. We're flushing down our toilets literally, and so we could be more efficient with water use, and that would down the line help with all these drought effects that we're talking about. But also I agree with what Kristen said, that sometimes we need to not think about mitigating or resisting these changes that are happening with climate change, because they are going to happen, and there's really not much we can do about it to some extent. And so something I've been thinking about is a lot recently with some colleagues is directing change in ecosystems that we know we expect to go through these changes. And one example we give is we're worried about coral reefs, for example, just being wiped out by combinations of disease and bleaching and all this because of temperature change. But what we're observing is some of these coral reefs are creeping poleward, and so we could think about really actually facilitating those changes. And one of our speakers talked about things like assisted migration. So those are some strategies that I think could be useful to not always just try to fight the changes, but to actually, and that's kind of a scary thought for some people, but to kind of facilitate some of these changes in ways that we think are best for, think about biodiversity or ecosystem function.
Mm-hmm. I will say in my line of work, I'm a social worker. There's a concept which is what you resist persists. And so y'all are tapping into that a little bit, just how do we, instead of just saying no, how do we adapt? Yeah. So those are I just learned a lot. Thanks for what you shared. Yeah. Oh, no problem. Who goes next? Yes.
Yeah. So being in the atmosphere where all the trouble started, sorry about that. There's sort of two main strategies. There isn't really mitigation. You can either take the carbon out, which I think is the best plan because having it not in the atmosphere solves all the problems you guys are talking about. And then the other thing is geoengineering, which I'm not a fan of. And I'm a fan of doing the research in it. So Dr. Fu does some of this, and I think it's critical that we understand what the impacts are, because I don't know that we'll ever get to a point where we really understand all the impacts of not only adding lots of carbon to the atmosphere, but adding something else to try and negate that. It just feels like you're painting over a bad color with another bad color. So I'm personally of the strategy that we should develop technologies as soon as possible, if not yesterday, to take carbon out of the atmosphere. This is sort of touching on things I don't do myself, obviously, but I think starting with actually trying to remove some of that might be our best strategy to at least prevent some of the things that we know are coming, at least from the atmosphere standpoint. So it's nice that we're talking next to each other so you can pick up the ball and talk more about that side of it too.
Yeah, I have two ways to control
Okay.
or mitigate, like Dr. Evans just mentioned, the geoengineering. So two ways. One is how is under the current climate until 2050. So another one is how to slow down the climate change. These are two ways. So two different ways, different control strategies. One is geoengineering. One is to under current climate and how to cool the upper air or the atmosphere temperatures. Because we are warming because CO2 emissions hanging there, 410 ppm CO2 concentrations. So how are we gonna cool down upper airs? This is one of geoengineering can contribute. But the reality is another question, yeah. But this is one solution to cool down. And another one is how to solve the current problem. Is one is based on the engineering perspectives, how to change in the building code to adapt to these climate changes. For instance, in the coastal lines, they have a more tide surge, storm surge, and cause a flood along the coastal lines. So those houses always be in the flooded, and they pay a lot of bills on that. It's $1 billion lost. And how are we gonna mitigate that? So maybe changing the engineering code for those future new home or the improve the current homes. The second direction, how to slow down the climate change, is carbon recycle, recovery, and reuse. This is currently talking about to develop technology to doing this now. And how are we gonna to reduce that? To another one is this COP26 talk about agreements. All the countries have a forest, don't touch it. Don't minimize the forest in their own countries. So this is one agreement now is discussed in COP26. Why? Because if we want to have a negative carbon emissions, only rely on the agriculture, forest, those are natures, soil and oceans to sink or to absorb the CO2 concentrations. So this we call a negative carbon emissions. So this is one of the following 10 or 20 years we are going to do that. One of the technologies called air captures is another one. Air captures to capture the CO2 emissions in the atmosphere and using the one of filters to absorb the CO2 concentration. This is another one, but it's very costly. So these are all the solutions. Two ways we need to do work on that parallels. It's working at the same times. So hopefully we can, in the end of the century, so we can down from 400 ppm. You know, some prediction is going to if we are still keep the using fossil fuel, we are going to 800 ppm of CO2 concentration, even 1,000. How to reduce that for the current CO2 emission or CO2 concentration in the atmosphere? We need to parallels doing that. So another solution we are working on, as I serve in the Arctic Council, we call the AMAP programs. It's the Arctic Measurement Assessment Program. We just have a presentation this morning, and then the COP26. Another solution is because the CO2 is a long life climate forces. So how about a short life? So you have a two curve to increase or the total the temperature cause, the rising temperature cause the pollutants. So we are focused on the methane and the black carbons, which is making the short life carbon forces. If we reduce that, so we can see the effects in the following 10 years. If we control CO2 today, we won't see any changes of the temperatures in the following 10 years. It takes decades or centuries. So the short life climate force is one of solutions currently we are going to do at this moment, especially for Arctic area, because Arctic region now is melting, as you know. The polar bear is nowhere to go. So they losing their home and they will come into inlands. So all the, not only the polar bear, all the marine and crossfield species and community will be changed. Even in Alaska, because the ice cap or the glaciers, they melt, and those are village in the water. So they need to move to another places, means relocations. Those are problems. And also their interstate or highways, if spill on the ice cap, it's a melting is a sunk. So every infrastructure is all damaged now. So how we gonna slow down the global warming or the typical the somewhere is warmings, and this is one of parallel solutions we need to deal with.
Thank you. Thank you. So we do have 3 additional questions that you all were presented. However, at this point, I'd like to see if there are any questions in the room or anybody that is joining us via Zoom. If you have any burning questions that you'd like to make sure that the panel responds to, I think we'll be able to address the last 3 that you were asked to reflect on. But at this point, I just want to make sure that in case anybody wants to participate, we have space for that. Yeah, so apologies if it is addressed at a later time. What can individuals do to help mitigate the effects of climate change? And that's related to one of our additional questions, like what strategies would you use to inspire individuals to take action around climate change as scientists?
My thought is that, whatever our expertise is, we can do something, maybe as an environmental activist to like varying degrees, to address these environmental concerns. For example, like if I think about my stand, I don't get to do a lot of outreach or extension activities, but a lot of my colleagues do. So they interact with the stakeholders and producers on daily basis. But my job appointment requires me to do a lot of lab scale and field scale experiments and publish those. But maybe I can take those publications and translate those to some materials which are more interesting and accessible to our stakeholders and our general public, so that we can translate whatever we are finding from our lab or field-based research to those who are actually making the changes on the ground.
Yes, but one question I have is, what do I do? Like if you were going to give me advice, we were in the grocery store and I heard that you studied soil science and I was interested in how can I contribute to helping our world stay healthy? What would you tell me to do?
Yeah, I may ask you if you have a small garden and if how much you till,
Yes.
That's my first question. And if you say that, yeah, I do that every day to control weeds and everything. So I may give you some solutions. How can you work around and reduce that tillage?
Okay.
So, that's one simple example.
Okay, that's great. Dr. Engman, you have something I can see.
So I think that like individual solutions are great. And, I think we've been kind of sold on the idea of, all of us should walk more and get an electric vehicle. And I think that's a great idea, but people, I think, need to start looking a little bit bigger. And I don't know if this is through voting or petitions or whatever, but I think we need to basically demand of leaders like broader change. And so it's not a very specific example or answer, but I really do think that that's what's going on, that there's a lot of changes that could have been happening, and there's a lot of people who are resisting those changes from happening, or people, or maybe large organizations. And so we need to just find a way to kind of push back against those, and not, a lot of people feel like really guilty, like, oh man, I drove too far, or I used the plastic straw. And great, let's all try to practice those practices personally. But if you spend you can spend a lot of time focusing on what you're doing as an individual, and you could actually put that energy into these kind of broader changes, to push for broader changes. So
yes, and if you were to choose a broader change, you're the king of the universe, you were going to choose a broader change, which would be the one you would say?
Well, I mean, I guess it's just reducing our fossil fuel emissions, right? I mean, I think we should all be utilizing electric vehicles right now, and I think we could be, and now again, it's not because people aren't choosing to. I just think that there's kind of a pushback against it, and using other sources of energy for industry, and that would reduce those emissions, and that's obviously the core driver.
Right.
Yeah.
But I definitely hear what your point is that we have individual decisions that we make every day. And you're saying that sometimes can be like a straw man's argument, that we actually have to have large systemic change and put our energy towards these large systemic change issues.
Yeah.
And for you, fossil fuels is the one.
Sure. Yeah.
Cool. All right, cool. Yes.
And I'll add education. One thing you can do personally is make sure that your educational system is teaching everybody climate change is something we can understand. It's not trivial, but if you can go through and explain why it's happening, and then the solutions, both explain the issue, but also solutions. People don't want to just hear that the earth is going to destroy itself, but that there's a way to fix it. I think that's the key.
Yes, thank you. Anybody else have a comment to this one? Yes.
Well, I just wanted to say I agree with what everybody has said. From a health aspect, that some things that we can do as individuals would be to just improve our overall health, because it's our underlying conditions that sometimes make us more vulnerable to the impacts of climate change. And then also, I mean, this has never been more apparent than in the middle of a pandemic, but, improving our social networks to increase our mental health resiliency can also benefit us after, the effects of climate-related disaster. The mental health impacts are pretty profound. And so having a social network, social support system can be very helpful as well.
Yes, these masks things. I'm a mammal. I want to see you smiling. It's hard. It's really hard. Yeah. Thank you. Go ahead, please.
United Nations have we call the Sustainable Development Goals. So they have a very good guidelines. And if we can utilize, actually UT now is utilize that and promote that to our students now. And we hope we can have those can be widely to the high school student, or maybe even in the elementary schools starting that. I have actually a presentation in the high school, the West schools. And also students, they are very interested about how to protect this environment. If you tell the kids, they like that. And then they can tell the parents, hey, you need to do that.
Yes.
And maybe this is one strategy to go to those younger people and the communities to start. And also another one is how to help them to understand the waste minimization, how important it is. Because waste why we have a waste? Because we cause a lot of CO2 emissions because of manufacturing for that. So we need to have those young kids, since they are very young, and then when they grow up, they carry all the mindset. And then we're doing the next generation, they were going to that, because these are cultural things. And it's not easy it's not a one day or overnight solutions. it takes a while, but I believe we get there. We will get there. Yeah.
So are you all, one of the questions, was about hope. The question specifically was, do you feel largely hopeful or hopeless about adapting to the future in the face of climate change? And what do you recommend to people who do feel hopeless? Yeah. So where are you on that continuum of hope to hopeless? And where would you say, how would you help people that are very helpless? Go ahead.
I still have a high hope on that. I do not have a hopeless, but only the time is slow. It's slowing. It's not like we want to change in that cultures like I just mentioned overnight. But I still keep a hope because even we do not join in the COP21 Paris agreement to reduce our CO2 emissions, but our national CO2 emissions is going down. If you look at the EPA's the chart to present to Congress, our CO2 on the national line is going down slowly. It's very slowly, but the trend is going down. But that means a lot of the industries, they volunteer doing that to reduce their CO2 emission in their process during the manufacturing. So I still think if we have, because currently if we control CO2, we do not have regulations yet. So if we don't have regulations, no guidelines to do that. It's not like air quality or water quality have a standards, and we have a goal to meet the standards. So I think I still have a high hope we will gradually to get there.
Thank you.
And I also agree with you. I also have a great hope because we have more scientific knowledge now than before about the seriousness of the problem. And also we have some potential solutions and support to do some actions. So these are all reasons to be hopeful. I wanted to go back to the agricultural sector, and where, like I mentioned earlier, we have soil-centric or climate-smart options available, and most of our farming communities already adopting at least one or two of those. So we just need to do more work to increase that awareness so that these practices can be widely adopted. So I found a literature which shows that globally, if producers adopt these better soil management practices, they can mitigate 8 billion tons of carbon per year, which is a great number. So that tells me that we have all the reasons to be hopeful. So, so you asked a question about what do you recommend to people who feel hopeless. I wanted to say that, say to those people to stay hopeful and be informed about the knowledge we are gathering, and also do what you can to educate your people around to your extent possible. And at the end, and also try to reduce the carbon footprint, as much as you can by taking mini steps like carpooling or things like that.
Thank you. Yes. I think whether I feel hopeless or hopeful depends on the day. Like you were saying earlier, I feel like, really what needs to happen is our leaders need to be focused on this change, and we need funding to modify our infrastructure, to do the research. And I feel like that pendulum swings like every couple years. And then on the hopeless side, I guess, being a public health scientist, a public health practitioner, I'm feeling a little less hopeful right now because of the general public's pushback against science through this pandemic. And so even though our science is improving,
I don't know that they're listening in general. So that is on the side of hopelessness. But on the hopeful side, I do feel like our younger generation, they are more activists. They're more prone to activism. And I think that with respect to, climate change, that seems to be a big focus. So that does give me hope. So I don't want to end on a negative note there.
Thank you. Anybody else want to comment on this one?
So I'm just gonna, for whether I'm hopeful or hopeless, focus on kind of my areas. And well, one is lead that with that. I consider myself an optimist generally, so I'll say I'm hopeful. But I study ecosystems and animal communities, and I've studied a lot of other anthropogenic impacts. And what I found is they're surprisingly resilient. Like you find, life finds a way, and so things might look different in the future, but you don't want to start. The worst thing you can start thinking is, oh, there's no value left in that anymore just because it's a little bit different. And so I think, I'm hopeful that hopefully we can maintain some of the things we have, but I also think that even if things are a little different in the future, they're still going to be really valuable to us. And, ecosystems are still going to function and exist, and animal communities might get kind of rearranged. But a lot of times what you see with really large impacts is there are some, extinctions of animals, but a lot of times you just see kind of this weird rearrangement of communities, which again, it's not necessarily ideal, but it's just different. And then again, going back to, what people can do if you feel hopeless is, I think again, to, start a petition, write your senator or representative, participate in a lawsuit, whatever you need to do. But I think we need to, again, really push for our leaders to kind of stand up on these things.
Mm-hmm. Very good. So one question that we want to make sure that we give you an opportunity to respond to, and you've touched on it a little bit, but I want to ask it one more time, is, what role should scientists have as environmental activists? And what are the ways that you speak to people who maybe don't understand the urgency of the climate crisis? So yeah, to what degree how does that fall in your bailiwick of your daily work as scientists?
All right. I started my career not wanting to connect science to activism. I felt like it's my job to say, this is the science. And then now I could be me picking up the ball as taxpayer activist and say, I have these opinions, but I do want to separate my own science results from what people do with them to some degree. But more recently, I see that there is a way to convey to people, and there's an educational opportunity. I learned this on the soccer field. When people are talking about things and you say, oh, well, actually, I do that for a living, and let me tell you why we think this. And you can use them in ways that are not threatening, and you can educate the public in a way that's maybe more, hey, I'm one of you, and I think this, and consider this. And also being, we work with climate, but a lot of us climate scientists started the world of meteorology. Climate science wasn't nearly something you studied back in the old days as you do now. And so talking about the weather, which everyone can understand, that's really the key, is understanding, my plants grow a little earlier than they used to. And my, these things, and you say, yeah, actually that's true. And here's why, and connecting those things which people can relate to every day to something. I guess I've evolved a little bit in becoming more connected, but I do as much as possible like to say, here's the science, and let others who are professionals at the policy say, based on that, this is where we want to invest our money. I have opinions as a personal, educated, taxpayer citizen, but I do like to separate them to some degree.
Yes.
When I currently serve the World Meteorological Organizations, and the new concept just released recently this year, we change into how we're gonna use the science results for the services.
Yes, I saw that on your slide, science for service.
Right.
Yes.
So this is the all the organization changing, reorganize their directions. We do a lot of the science research. How we gonna transform those research to the services, which is services to our sister organizations such as WHO, FAO, or even the WTO trade organizations. So this is how we gonna transform those science results to the services and utilize those results to our daily life. And also I mentioned earlier how to integrate the engineering and the earth system sciences together, how we're gonna utilize those data to engineering solutions. And this is the one, mainly the one trend, or what we are going to these directions. Because eventually we still need to solve the problem. Not only the phenomena, only we need to have a solutions, and people are eager to have a solutions to changing our life, have a less impacts. So this is the one I would say, the bridging science to the services. We need to have more people doing that, and this needs the manpower as well. And this is going to be a globally goal for that for the next decade.
Thank you. I'd like to agree with you. I started off my career just thinking I want to do good science, leave the policy to other people, but they really do go hand in hand. You know, I've seen, you know, just in the last few years, work that I was directly involved with, like implement very small policy changes, like a health impact assessment we worked on. A policy change was to require that wastewater management treatment facilities, you know, just basically raise their electrical panels like above the flood zone, so that in the event of a flood, they didn't have to shut down because, you know, the power went out. I mean, something simple like that, to having, you know, states and local jurisdictions incorporate health into climate adaptation plans. And so I think as a scientist, you really have to see how your work is going to influence policy and serve as an expert in that capacity to make change. And I also think that as a scientist, we also have the requirement to educate. And so something that we teach in our program is how to use cultural humility to get the message to the populations that you need to get the message to. And something that we did when we were, you know, working on climate and health in Florida was to create these touchstone summaries of the climate impacts on human health by basically, you know, going back to examples of, I mean, you wouldn't think of this, but like a winter storm in Florida that led to snow and power outages, and like pulling newspaper articles about like how that directly impacted their community, and like just making it tangible and personal really does help communicate to that person who's resistant to the even just the idea that the climate is changing. Did anybody else? Yes.
Yeah, I also agree that, you know, we need to step out of our office at least once in a while and try to connect with the general public or other stakeholders, because otherwise, how do they know the cool research we are doing? And people like me are not very good at doing that, but I think we all have to try. And personally, I would like to make a better effort to connect soil and people, because that connection has been kind of lost, and we need to re-establish that to achieve this whole One Health for all.
Thank you. I actually have a follow-up question to that. So Dr. Engman, you said that mussels are like liver for the river. And I'm curious, what would be the metaphor for soil? Like, what is the metaphor of soil? Like, mussels are liver to the river. Is there like another way of understanding soil?
Soil is the heart of the One Health or human.
Yes, yeah. I think that's a valuable question. You know, the use of metaphor to help lots of different disciplines understand, because we can get so detailed in our particular science because we're so good at it. Sometimes we have a hard time communicating across. Yeah. So I loved that. So
I didn't come up with that, by the way, though. So I'm not taking credit for it.
You can't take credit for it, but
I just liked it.
Yeah, but I learned it. Where did you hear it?
Actually, first from a PhD student, we were doing our PhDs at the same time. She was studying muscles, and I think she got it from somewhere. I don't know who first coined that term.
So it's a nervous vessel of muscles.
Yeah.
If you can have that.
I'll come up with something cool for next time.
Okay, sorry to put you on the spot.
I was really impressed. That's what I was like, man.
Good.
I didn't come up with that.
Soil is sort of the cleaner of our air and our water. You know, soil is the liver for everything else.
We usually say it's the backbone of agriculture, but I think it is more than that.
Yeah. So you're saying that muscles are liver for the water, but soil is the liver for everything else. It cleans everything else, including water too.
Absolutely, yeah.
Okay, so muscles don't have the corner on the market of being the liver.
No.
So those of you that are in the room, I'm just curious before we end, are there any burning questions you have or anything that you learned, an aha moment from being with our panel today? And I love awkward silence because I'm a social worker. Go ahead, yes. Here.
Trying to wrap my mind around all that's going on in climate change, and I'm particularly struck. I did hear that, you know, yes, our younger generations are more activist oriented, but I also see that there's such hopelessness often, which leads to poor mental health. And I wondered if Dr. Kitzinger could talk about the connection, because this is, you know, obviously we're talking about health, and I think adults, you know, especially within education and so forth, we have a different sense of resiliency, but the younger generations, especially if their parents are climate deniers or, you know, live in states where their leadership is not leading on this issue, it can be very dismal. And I just wondered if you could speak to the younger generations who are struggling to find mental health resilience.
Yeah, sure. So I think that so I think that one of the things that we've been seeing in climate change arenas is that by educating the younger generation that you actually can make changes in the older generations, because they take that knowledge home and educate their parents or their extended family. Yes, there's going to be some resistance, but I mean, my advice would just be keep trying. Like any little change that you can get your family to make, like starting them to just recycle one thing at a time, like even if it's just recycle plastics. I mean, that is just one step, and you take another step once you get them on board with that. I mean, so all of those little things, you know, are a place to start and to help you feel like you are doing something, and then get involved in organizations that you, if possible, I mean, even in areas that are less likely to have, you know, active organizations affecting climate change. I mean, 4-H programs are, you know, very STEM focused now, and that's an area that you could get involved with to make change and to educate your community. And you know, simple things like setting up your own Be a Buddy program to reach out to, you know, vulnerable members of your community when there is a threat of flood or a heat event or something like that. So even if you feel hopeless, you can make small changes that do have large impacts on, if not like the grand scale, at least on somebody's life.
I can say some examples. Farmers, they always depends on their grandparents, many generations. And they always feel they can see the weathers from their generations. But currently the climate change causes them to gradually to believe the climate change and not rely on their generation knowledge. Why? For instance, all the total precipitation for a year not changing too much, but the changing is to the concentrate in 1 or 3, 4 days a week, and left of the season is no water, no precipitations, and that causes a different experience of what they had or have in the generations. That change in their mind. This is why I have a touch base with all the people. They talk about that. So this is a different way to influence the older generations, and particularly is experiencing. If they're experiencing the climate change, they will gradually to believe that, and then maybe will get help, and then rely on all the meteorology data, forecast data, not rely on their own experience. Yeah, they always tell us, "Hey, I know the next year's what looks like. I know the next 3 months it looks like." But now it's not, because extreme events cause a difference. So this is my one of the token to share with it.
Well, thank you. Are there any other final comments? We've got about 4 minutes left of our time today. Are there any final comments that any of the panelists want to make, or anybody online, or anybody in face-to-face with us today? Yes, please. Here we go.
Yeah, I was gonna say I'm loud enough.
No, because of the Zoom. I worry.
So, so I'm originally from Brazil, and you know, when I see different countries meeting in Glasgow and talking about all the goals that they have towards climate change, and you know, I personally don't believe that, you know, whatever Brazil has agreed to, they're going to come through with that, just because, you know, growing up there and knowing how things work on a government level, I just don't believe that's going to happen. And I think that may be the case for lots of countries that are, you know, just sitting out there and making all these promises that they may not be able to keep. So with that being, you know, with that in mind, do you guys think that we need more of a global approach where we have policies that expand on a global level? Or do you think that we're okay with just letting each country run with whatever they think is best for them, and you know, hopefully we're keeping up with the promises?
Thank
you. Okay, I can share with that. I have a project is going on. It's not funded yet, but I already have a 1 year's assessment in Brazil. So you're just talking about regulation, right? But when those farmers, they would like to survive themselves or adapt themselves. For instance, the aflatoxin. Aflatoxin is for all the crops, right? So there is a temperature and the relative humidity. So the farmers, they adapt themselves without the government to involve, because this is all they can survive. Well, can I say maybe take it back and survive, like how they can get better for their productions. So this is my experience in your countries, because those are companies we are working on in those farms, because they are huge farms. They are managed by or operated by the big company. And those big companies, they have their own strategy. Like I say, we do not have a CO2 the regulation at this moment in the countries. We don't have a standard yet. We are going to have a standard, but we haven't a standard implemented yet or propagated yet. But our CO2 emissions still is going very slowly going down. It's not like going up like this. So I think it's you know, this is a different way. I mean, if you rely on only government, it takes a while. Because legislations you take a debate for different years, and you know, so the company, they have their adaptation ways, because they still need to make a profit. So they will do it themselves and support themselves and looking for some help themselves. So,
does anybody else want to respond to that question before we end?
I do.
Okay, you're so glad. Yay.
Geronimo, you make an excellent point. I really think you do. But I think it's going to be your generation and the generations after you that have got to say, hey, look, we said we would do this and we are going to do it. And I think in the meantime, because as you guys are getting into power, things are still going to be plummeting, right? We got to have our governments putting money into this to help us fight this. And they've got to see that. And I think maybe if they're kind of forced to do that, like, okay, well, we'll throw some money at this, then it's got to be the people who get that money to use it to make a difference. Because I think if they put money into it, but it kind of, doesn't really do anything, we're not going to see that change. And then your generation and those after you are going to have a tougher time with it. And I really think, though, you guys have good voices and you can really step up and make a difference.
I second that. Rock on. Thank you all so much. I learned so much really from being able to get to connect with you all today. Thank you everybody that's online. Thank you for the One Health Initiative for pulling all this together.